wisdom and support as we begin the 7th regular meeting of our committee. Help us to engage in meaningful discussion, allow us to grow closer as a group, and nurture the bonds of the HREP community, our stakeholders, and especially the Filipino people whom we serve. All this we ask in the name of Jesus Christ our Lord. Amen.
Thank you. Do I hear a motion to dispense with the calling of the roll?
Mr. Chair,
Congressman Garcia.
may I move to dispense on the calling of the roll to expedite our committee meeting.
Any second? There's a duly seconded motion to dispense with the calling of
On
the roll. Hearing no objection,
calling of the
the calling of the roll
To
is now
expedite our committee
now
meeting.
dispensed with. Any motion to dispense with the reading of the minutes of the previous meeting?
Mr. Chair,
Yes, Congressman Garcia.
may I move to dispense with the reading of the minutes of the previous meeting?
Second.
There's a duly seconded motion to dispense with the reading of the minutes of the previous meeting and the adoption of the same. Hearing no objection, the motion is carried. At this point, we'd like to acknowledge the presence of the members of the committee. Here, physically, we have Honorable Maria Angela Garcia. And on Zoom, members of the committee. We have here Patrick physically, we have Honorable Maria Angela, Honorable Maria Vanessa Aumentado, Honorable Maria Lucille Nava, Honorable Jervil Luistro, Honorable Doris Manikis, Honorable Fernando Cabredo, Honorable Anthony Rolando Goles, Honorable Carmelo John Lazatin II, Honorable Jaisel Victoria Yu, Honorable Maria Victoria Co Pilar, Honorable Jerny Jet Nisay, Honorable Maria Rachel Arenas, Honorable Salvador Prieto, Honorable Maria Carmen Zamora, Honorable Augustina Dominic Pancho, Honorable Ruth Mariano Hernandez, Honorable Eulogio Rodriguez, Honorable Jocelyn Tulfo, Honorable Yasser Alonto Balindong, Honorable Doris Manikis, Honorable Eleanor Bulot Begtang, Honorable Maria Jamina Catherine Agarao, and Honorable Yevgeny Vincente Emano. Thank you for your attendance.
Mr. Chair, this is Stella Kimbo. Present po.
Yes, we acknowledge also the attendance by Zoom of Stella Kimbo. Any
Mr. Chair,
I miss?
Mr. Chair, Congressman Ricardo Cruz, Taguig, present.
Congressman Ricardo Cruz is now
Taguig.
acknowledged.
Mr. Chair, Congresswoman Laarni Roque of Bukidnon, present po.
Yes, I already acknowledged your presence earlier, Congresswoman Roque.
Thank you, Mr. Chair.
I think I saw the name of Congresswoman Charis Hernandez. Thank you very much. May we now call COMSEC to acknowledge our resource persons this morning.
Good morning, Chair, honorable members of the committee. In attendance for today's meeting, on the part of our resource persons from the Department of Health, Assistant Secretary Beverly Lorenho, Dr. Melissa Sena, Dr. Julius Kim Patrick Tejano, from the Philippine Pharmacists Association, Dr. Hilda Salhay, from the UP National Institute of Health, Dr. Maria Esterlita Uy, Dr. Marimel Pagkatipunan, and Dr. Joan De Castro. From the Philippine Medical Association, Dr. Minerva Kalimag, the PMA's president. From the Philippine Foundation for Vaccination Incorporated, Dr. Lulu Bravo and Dr. Ron Jean Solante. From the Department of Interior and Local Government, Ms. Jo Reyes. From the Department of Agriculture, Mr. Jomari Panaga. From the National Nutrition Council, Ms. Jomari Tongol. From the Bataan General Hospital and Medical Center, Your Honor, Dr. Glory Baltasar and Ms. Marjorie D. Mena. That is all for now, Your Honor.
Thank you, Comsec. At this point, may I now read the opening statement? Good morning and Happy New Year to everyone, distinguished colleagues, and to our esteemed guests and resource persons. Our first agenda for today are bills which seeks to protect Filipinos from the harmful effects of industrial trans fatty acids. The elimination of harmful trans fatty acids in the Filipino diet is critical, as it is one of the leading causes of non-communicable diseases, or NCDs, like cardiovascular diseases, particularly coronary heart disease, which accounts for nearly half of the world's non-communicable disease-related deaths. According to studies by the World Health Organization, trans fatty acid intake increases the risk of death from any cause by 34%, and from the coronary heart disease by 28%. It has also been associated with increased risk for other non-communicable diseases and related conditions such as ovarian cancer, infertility, endometriosis, Alzheimer's disease, diabetes, and obesity. As coronary heart disease remains to be one of the leading causes of death in the Philippines, with 29,442 cases, or 18.7% of the total deaths, there should be an intensified campaign to conduct comprehensive studies on trans fatty acids and generate public awareness and support towards the institutionalization of trans fatty acid elimination measures. According to WHO, the TFA elimination is one of the simplest and most straightforward public health intervention to reduce the risk of CVDs and improve nutritional quality of diets. Countries that regulated TFA have seen significant decline in the coronary heart disease deaths. For example, Denmark's regulation limited TFA content to 2 grams per 100 grams of fat in food products, contributed to a 75% reduction in coronary heart disease-related deaths. As more countries regulate the TFA, countries without regulations become vulnerable to dumping of TFA-rich imported food. To protect people from diet-related NCDs, food compositions, marketing restrictions, nutrition labeling, and taxation policies should be carefully formulated to produce rigorous standards. In the bid towards making Filipinos and our healthcare system more resilient to future public health emergencies, it is imperative to respond to the global call to eliminate the TFA, or the trans fatty acid, by 2023 through the passage of this bill. For the information of the honorable members of the committee, this proposed legislation was deliberated upon and approved by the committee towards the end of the 18th Congress. Although, due to lack of time, this was not scheduled for deliberation at the plenary level. At this point, the chair would like to acknowledge the authors of the following House bills. House Bills number 1485 by Representative Maria Ann Lourdes Matibag. House Bill 2548 by Representative Keith Micah Tan. House Bill 4379 by Representative Alfred de los Santos. House Bills 4737 by Representatives Luis Raymond Villaferte Jr., Miguel Luis Villaferte, Chuyoshi Anthony Horibata, and Nicolas Enciso VIII. House Bill 5099 by Representative Gus Tambunting, and House Bill number 6341 by yours truly. The chair would now call the Honorable Maria Rene Ann Lourdes Matibag first to deliver her sponsorship.
Good morning to the chairperson of the Committee on Health, Congressman Siraj Gato, and all the members of the committee. I am honored to be here today to sponsor my bill, House Bill number 1486, an act to protect the Filipinos from harmful effects of trans fatty acid and for other purposes. Non-communicable diseases such as cardiovascular disease, diabetes, and hypertension are among the leading causes of deaths and disability worldwide, including the Philippines. In fact, it is now more common to hear about people in their 20s and 30s suffering from and dying of these diseases. In fact, I know one of my constituents who died of heart disease in his 20s. It is very heartbreaking to see my constituents and our fellow Filipinos die very young due to factors which we can be very much of control. Unhealthy diets are one of the biggest risk factors for these non-communicable diseases. According to the WHO, the consumption of trans fatty acids is among the biggest causes of unhealthy diets. Countries around the world have begun to ban DFAs in their food products, and because of this, the Philippines has become a dumping ground for foods with DFAs exported worldwide. This leads to socio-economic strain, leading to a heavy cost on our healthcare system and lessening productivity. This bill, Chair, and to the members of the committee, seeks to protect Filipinos from the harmful effects of DFAs by prohibiting the manufacture, distribution, importation of food items which contain them. It also seeks to help our local food manufacturers to switch to healthier alternatives, which are not only cheap, but also do not alter the taste of foods by providing training for businesses, incentives for earlier compliance. By instituting this measure, we are not only saving the lives of our people, but also saving our government billions of pesos, not just in healthcare claims, but also in lost productivity, with a very cost-efficient policy such as regulation of trans fat. In light of this, I am urging my fellow lawmakers to pass and support this bill. Maraming salamat po.
Thank you very much, Congresswoman Matibag. Before we proceed, I'd like to acknowledge the presence, their physical presence, Honorable Franz Castro, Honorable Joseph Gilbert Biolago.
Good morning, Chair.
And Honorable Carl Nicolas Cari, and Honorable Rodolfo Ordonez. Thank you very much for your presence. And on Zoom, we'd like to acknowledge the attendance of Honorable Maria Rene Ann Lourdes Matibag, Honorable Ernesto Junicio Jr., Honorable Ramon Rodrigo Gutierrez, Honorable Baby Aline Vargas Alfonso, Honorable Ron Salo, and Honorable Mark Go. Thank you. May we now call on Honorable Mike Tan for his sponsorship speech on House Bill 2548.
Good morning, Mr. Chair, and good morning to our resource persons. The proposed bill seeks to regulate the use of trans fatty acids in the country that has been dubbed as the tobacco of nutrition. Particularly, it seeks to regulate the manufacture, importation, distribution, and sale of food products with high TFA, as they contribute to 500,000 deaths each year globally. Trans fat, a type of dietary fat and considered to be the worst for health, increases the risk for heart disease and other health problems. TFA increases the risk of death by 34%, and coronary heart disease mortality and morbidity by 23% and 28%, respectively. Non-communicable diseases kill 41 million people each year, contributing about 71% of all deaths globally. In the Philippines, NCDs account for 68% of all deaths. 1 in every 3 Filipinos is likely to die before the age of 70 from one of the 4 major NCDs, mainly cardiovascular diseases, cancer, diabetes, or chronic respiratory diseases. CVDs, particularly coronary heart disease, account for nearly half of the world's NCD-related deaths and claim around 70,000 lives in the Philippines every year. Trans fat is made when food makers turn liquid oils into solid fats, like shortening or margarine, and can be found in many fried, fast packaged, or processed foods, including fried and buttered foods, margarine, cakes, cake mixes, pies, pie crust, and donuts. Most TFAs come from processed foods. The move to eliminate TFA strongly echoes the adoption of an integrated and comprehensive approach to ensure that all Filipinos are health literate, provided with healthy living conditions, and protected from hazards and risks that could affect their health, as well as the provision of access to a comprehensive set of quality and cost-effective promotive and preventive health services as enunciated in the Universal Healthcare Act. I believe that this important piece of legislation is significantly urgent, especially during this time of COVID-19 pandemic, where patients with comorbidities like coronary heart diseases have a higher risk of serious illness or death. It needs stressing that so many COVID-19 deaths in the country had comorbidities. Now more than ever, the need for preventive healthcare and healthy lifestyle promotion must be realized in line with the vision of the UHC. Once it becomes a law, the manufacture, importation, and distribution and sale of the following will be prohibited: partially hydrogenated oil to be consumed alone or used in preparation of food products, oils and fats made or blended with PHOs, and oils and fats with TFA content more than 2 grams per 100 grams, excluding TFA content from ruminant sources. The World Health Organization believes that TFA elimination is one of the simplest and most straightforward public health interventions to reduce the risk of cardiovascular diseases and improve nutritional quality of diets. Allow me to thank the Honorable Committee for this opportunity, and may I respectfully ask for a favorable consideration of this important health measure. Thank you.
Thank you very much, Congressman Attorney Mike Tan. May we now call on Congresswoman Garcia to sponsor in behalf of Congressman Alfred de los Santos on House Bill 4379.
Good morning, Mr. Chair. On behalf of Congressman Alfred C. de los Santos, I would like to sponsor House Bill number 4379, entitled An Act to Protect Filipinos from the Harmful Effects of Trans Fatty Acids and for Other Purposes. May I move to adopt the explanatory note of Congressman de los Santos?
Thank you, Congresswoman Garcia. Also for House Bill number 4737, Congresswoman Garcia again for the sponsorship speech.
Yes, Chair, on behalf of the authors of House Bill 4737, may I move to adopt the explanatory note of said bill. Thank you, Mr. Chair.
Thank you. Also for House Bill number 5099, by Representative Gus Tambunting, Honorable Congresswoman Garcia.
Yes, Mr. Chair, on behalf of Congressman Tambunting, may I sponsor House Bill number 5099 and move to adopt the explanatory note as the sponsorship message.
Thank you. And now may I sponsor House Bill number 6341. I have already stated my statement with regards to the trans fatty acid. So may I move that my explanatory note be adopted as my sponsorship speech. I may just add, I think this is the elimination of trans fatty acid is long overdue. There is no question that it is harmful. We know that it's been used to prolong. Sabi nga nila, pinapahaba ang shelf life ng mga processed foods. Binibigyan ng it adds more taste daw, and it adds more taste, shelf life, and it is convenient, and also in the preparation of processed foods, pwedeng gagamitin ulit-ulitin yung trans fat. Kaya nga ginagamit ito madalas sa mga industrial or manufacturing food manufacturers. But we all know na kahit ito very accessible, it's cheaper, it's supposed to make food more attractive. The ill effects or the harmful effects of trans fatty acids, as we have heard and we have seen and we all know, ay napakalaki ng pinsala sa ating population. So it's about time na kailangan na natin ma-approve ito. I have already made a commitment during the World Health Organization meeting on cardiovascular diseases na kailangan talaga natin ito ma-approve na. I-eliminate na natin ang trans fatty acids. So it is in this light that we hope that for the approval of these bills on eliminating trans fatty acid in our dietary food. Thank you very much. So at this point, may we now hear comments from our resource person. From the Department of Health, Yusek Beverly Ho.
Good morning, sir. Good morning, Chair. The Department of Health, through our Health Sector Strategy 2023 to 2028, envisions a country where communities, workplaces, and schools are supportive of healthy behaviors. And in our efforts to direct policies and programs towards health promotion and preventive care, we also recognize the importance of creating healthy food environments in order to improve the nutritional status of all Filipinos. Thus, having alternative food choices made available is a crucial step towards creating these health-supportive environments to foster healthy diets among the population. In 2021, the DOH has issued an AO on trans fat acid elimination. However, we do know that our administrative issuances have limitations, and so we really welcome this initiative of the legislature because in our AO, we will not be able to regulate all TFA in all food sources, which only the legislature will be able to do. Trans fatty acids are known to be the tobacco of food and have absolutely no substantial health benefits. High consumption of TFA is also linked to increased risk of coronary heart disease, type 2 diabetes, autoimmune diseases, and other NCDs. In the Philippines, 7 of the top 10 leading causes of death are NCDs, and many deaths from NCDs are premature, occurring between the ages of 30 to 69. In view of the foregoing, the DOH supports the passage of the House bills numbered 1485, 2548, 4379, 4797, 5099, and 6341, all of which aim to eliminate industrially produced TFAs from the nation's food supply. The WHO notes that the elimination of industrially produced TFA is one of the simplest public health interventions that can address NCDs worldwide. It is for this reason that we fully support this initiative. We will just submit more detailed comments about details, certain provisions na lang po. Thank you very much.
Thank you, Yusek Bev. May we now hear from Dr. Maria Victoria Piñon of the Food and Drug Administration.
Good morning, Mr. Chair and everyone. The FDA supports the proposed House bills, including the substitution of House bills numbered, the 6 House bills that were received by the FDA. And we have, actually in support of this, we have issued FDA circular number 2021-028, as well as its updated guidelines, namely on processed prepackaged food products containing industrially produced trans fatty acids, amending FDA Circular Number 2021-028 entitled Guidelines for Prepackaged Processed Food Products Containing Trans Fatty Acids. So once the House bill will be legislated, the FDA will be enforcing the legislation, and we will be submitting detailed comments for these House bills. Thank you very much.
Thank you. Please do submit your official position, Dr. Pinion. Any comment from any member of the committee? Yes, Congresswoman Castro.
Yes, Mr. Chair, I just would like to ask the resource speaker who spoke earlier about their memo on the banning. Is that correct? Pagbaban po natin ng mga trans fat. Tama po ba 'yon, yung meron silang memo dun sa pagbaban ng mga trans fatty acid sa mga pagkain?
Yusek Ho.
Thank you, Chair. Yes, ma'am, we do have an AO po, but it's only for already prepackaged food kasi yung sa existing food stalls, hindi naman po yan authority namin ngayon. So it's an administrative order po of the DOH back in 2021 June. May target po. So na-consult po yung industry. Then yung effectivity po niya is actually 2023 na July. Pero hindi po siya extensive po for all foods in the supply chain now. Kasi syempre limited lang din po yung authority namin. Thank you po.
So, ibig sabihin, Mr. Chair, so yung ating legislation, this applies to all foods. So, yung pagkakaiba nung sa memo ng Department of Health ay parang mga limited lang. So,
Yes.
how do you implement that memo? Mr. Chair, meron ba kayong enforcement power just in case?
Ma'am, bale po FDA po yung enforcement authority namin. So maybe our FDA counterparts can answer po. Pero kasi the industry was given 2 years adjustment period. So 2021 lumabas yung issuance, is July 2023 para po yung effectivity. Apo, thank you po.
May we
The
hear
FDA.
from the FDA, Dr. Pinion?
Yeah, thank you, Mr. Chair. Actually, the FDA circular that we have issued only prohibits the industrially produced trans fat. So it's not all trans fat. If you will allow me, Mr. Chair, to specify that provision, it is stated that the manufacture, trading, importation, distribution, and sale of the following shall be prohibited. Number 1, partially hydrogenated oil to be consumed alone or used in the preparation of processed food products. Oils and fats blended with PHO and prepackaged processed food with PHO and industrially produced trans fatty acid content of more than 2 grams or 100 gram or ml. So it's only for prepackaged processed food. Thank you.
So, thank you, Mr. Chair. So, may I know how this memo being implemented dun sa sinasabi nating sa mga industry, Mr. Chair? Kasi yung FDA po ba nakahuli na or nakahuli na po ba tayo ng mga company or entity that are manufacturing or distributing trans fat? So how is the implementation, Mr. Chair?
In other words, under the present memo, very limited ang scope. And besides, this was made 2 years ago at mukhang 2 years at the height of the pandemic. I think it's a very short time for it to be evaluated or assessed whether it was really effective or not. But nonetheless, with the approval of this bill, this bill, if it becomes a law, will give more teeth, and then it will become all-encompassing. So it will cover all food products. Am I correct, Yusek Bev?
Yes, Chair. Also because the DOH and by FDA's authority, they issue product registrations po, 'di ba, for available food in the market. So whatever is being prepared or sold in the market that's not requiring FDA certification. So like whatever is served in restaurants, for example, or basta yung hindi po may permit from FDA, we have no authority for that. So I think that's what the bill will be able to encompass po. Thank you po.
But the question of Congresswoman Castro, meron na bang apprehension, meron na bang arrest, o meron na bang record na mga violators?
Sir, wala pa po kasi yung effectivity is July of 2023 pa. So
Okay.
dapat it should be taken into account dun sa mga mag-a-apply po for permits July 2023 onward. So kung meron pa silang industrially produced TFA, merong authority si FDA to not give permits na to them. And kung mag-check sila sa labels of whatever's in the market, they can exercise their authority. Pero July 2023 pa po kasi yung effectivity. Thank you po.
Congresswoman
Mr. Chair,
Castro?
curious lang ako, no? Ito bang mga trans fatty acids po ba ay like yung binanggit niyo po kanina, yung mga margarine, yung mga ano. So, ito po ay dito ba ni mina-manufacture or ini-import natin yun? Yung mga trans fatty acids. Is it being manufactured locally or we import those?
Mr. Chair, Rodney
Yes,
Carza,
Dr.
Rodney Carza from the Department of Health Promotion Bureau.
Yes, please
Director.
proceed.
We do have a local market on TFA, but we also do import products with TFA content. And the spirit of the AO po and the FDA circular is by July 2023, which is our target elimination for trans fat. We won't be registering or accepting these products anymore.
Okay, thank you, Mr. Chair.
Thank you. Just a question. Ang margarine ba, can you make a margarine without TFA?
Mr. Chair, I think margarine contains TFA as well. And I think that's also the spirit of the bill to increase our research capacity in reformulating our food products. So industry will be provided support to reformulate their products, including.
So we will, with the passage of this bill, we will have margarine without TFA.
It's part of the research component, Mr. Chair. Yes.
Thank you. May we acknowledge the presence of Honorable Journey Jet Nisay, Honorable Steve Chongbian Solon.
Thank you, sir.
Honorable Peter Miguel, and Honorable Angelica Natasha Ko of BHW. We now call on Dr. Miss Jomay Tonggol from the National Nutrition Council.
Good
Miss
morning.
Tonggol?
Good morning. Can you hear me po?
Yes, loud and clear. Please proceed.
Yes, good morning, Honorable Chair. So the National Nutrition Council Secretariat, kami po yung executive arm of the National Nutrition Council Governing Board, which is the highest policy-making and coordinating body on nutrition in the country. We facilitate processes along the formulation of the Philippine Plan of Action for Nutrition, or the PPAN, which is the country's framework for nutrition improvement. PPAN is an integral part of the Philippine Development Plan and contributes directly to the achievement of the Sustainable Development Goals, particularly goal number 2, which is to end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. And also goal number 3, which is to ensure healthy lives and promote well-being for all at all ages, and indirectly to the achievement of the other SDGs. So the NSC Secretariat spearheads the concerted efforts of the nutrition institutional network from the national level up to the local government units to ensure enactment of laws and ordinances that will provide an policy environment for long-term solutions to existing nutritional problems and the development and implementation of programs and projects that will address causes of all forms of malnutrition, so that is both the under and overnutrition. NSC supports House Bills 1485, 4379, 2548, 4737, 5099, and 6341, entitled Trans Fat Free Act, Trans Fat Free Philippines Act. And because an estimated 3,067 deaths due to high intake of TFA could be prevented annually with the enactment and enforcement of this legislation. So the NS highly recommends the immediate passage of these bills, and Honorable Chair, we will submit our official position papers on the House bills mentioned. Thank you once again.
Thank you very much. From the Department of Agriculture, may we hear of Ms. Rosella Villaruel?
Good morning po, Mr. Chair, and all the rest of the participants. First of all, the Philippine Coconut Authority of the Department of Agriculture already expressed its support to the bill. However, we submitted our position paper for the removal of the phrase with low levels of saturated fatty acids in the definition of healthy alternative oils, fats, and oilseeds. Because if the phrase will be retained, it will automatically cancel our coconut oil as a healthy alternative oil, since the composition of coconut oil is both unsaturated and saturated fatty acids with a higher level of saturated fatty acids. Further, we also manifest that there is a need to emphasize that the saturated fatty acids in coconut oil are mainly medium chain fatty acids such as lauric acid, which is beneficial to health. And there are already a lot of studies supporting this benefit. In fact, during the pandemic, it was proven by a study conducted by our Department of Health that DCO can give rapid relief of mild to moderate symptoms of COVID-19 and rapid decrease in the level of C-reactive proteins in the blood. We will submit all these copy of the studies, Mr. Chair.
Thank you. Please do submit. May we hear a comment from the Department of Health regarding the low levels of fatty acids in coconut oil? Is the low level low enough or not enough?
Sir, from our end, our research shows that there isn't enough categorical evidence to say whether coconut oils are healthier or not. And so in the substitute bill that was circulated to us, it used the word possible healthy alternative. We're comfortable with that po. So parang hindi lang po siya i-commit as already the healthier choice, but a possible healthy choice.
Okay. We'll take note of that. Thank you very much, Yusek Bev. Any other comment? It appears that everybody agrees with the bill. Do I hear a motion for approval of the substitute bill?
I move that the substitute bill be approved by the committee, Mr. Chair.
Okay, there's a motion by Congressman Diolago and duly seconded by Honorable Castro and Honorable Garcia, that the substitute bill on House Bills 1485, 2548, 4379, 4737, 5099, and 6341 be approved. Hearing no objection, the substitute bill is now approved.
Sir Chair, may I also manifest that all the members who are present today who wish to become a co-author of this substitute bill on the act to protect Filipinos from harmful effects of industrial trans fatty acids and for the other purpose be the co-author. Thank you, Mr. Chair.
Second the motion, Mr. Chair.
There's a duly seconded motion that all those present today, physically or by Zoom, be included as co-authors of the bill. Hearing no objection, the motion is carried. The committee secretary is directed to prepare and subsequently file the necessary committee report, subject to style and amendment. Next, we now move to the next bill on national concern, the deliberation on mandatory immunization program. Correct na tayo. May we now call on Attorney Congressman Attorney Mike Tan for the sponsorship speech of House Bill number 289.
Thank you, Mr. Chair. Good morning po ulit sa ating lahat. I would like to thank the committee for giving this measure an opportunity to be heard today. A similar proposal was passed on final reading last Congress following a vaccine controversy that had somehow tainted the credibility of the Department of Health's immunization program, including those that were listed to address the vaccine preventable diseases as provided under Republic Act 10152. The vaccine hesitancy that caused unsettling effects to the government's immunization program was further exacerbated by the COVID-19 pandemic that relegated essential health programs such as the immunization program at the sidelines. That is why the timing for the enactment of this measure cannot be more perfect, as the country is looking forward toward to making our people more health resilient. The bill proposes the inclusion of tuberculosis, diphtheria, tetanus, pertussis, poliomyelitis, measles, mumps, rubella, or German measles, hepatitis B, human influenza type B, rotavirus, Japanese encephalitis, pneumococcal conjugate vaccine, human papillomavirus, and booster for measles, rubella, tetanus, and diphtheria in the list of vaccine preventable diseases. It also restricts the discretion of the Secretary of Health's power to include vaccines in the mandatory immunization program by putting the National Immunization Technical and Advisory Group, or TAG, including the health panels of Congress, into the picture. This amendment makes the process more inclusive and transparent. As it is, the determination by the Secretary of Health to include or introduce such other types of vaccines in a department circular can only be made upon the recommendation of the NITAG and only after presentation in a joint public hearing of the health committees of Congress. This is one of the outstanding features of this proposal, in addition to the expansion of the list of vaccine preventable diseases in the mandatory immunization program, which will no longer be just for infants and children, but for all age groups of Filipinos. Another important feature of this bill is the inclusion of the mandatory immunization services that are specified in the bill in the PhilHealth's benefit package. If enacted, the measure would repeal the Mandatory Infants and Children Immunization Act of 2011 and pave the way for a more reinvigorated, relevant, and responsive immunization program that the country so badly needs at this point. Thank you, Mr. Chairman.
Thank you, Congressman Tan. May we now call on Congressman Carl Curry for his sponsorship speech on House Bill number 414.
Thank you. Thank you, Mr. Chair. I further move that my explanatory note be adopted as my sponsorship speech.
Thank you, Congressman Curry. May we now call on Congresswoman Garcia to sponsor in behalf of Congressman El Rey Villaferte Jr., Miguel Luis Villaferte, Chuyosi Horibata, and Nicolas Enciso on House Bill number 1092. Congresswoman Garcia.
Yes, Mr. Chair, I would like to sponsor House Bill number 1092 on behalf of the authors and adopt their explanatory note as their sponsorship message. Thank you, Mr. Chair.
Thank you. And also for House Bill 1748 authored by Congressman Alfel Bascog and Edibong Plaza. Congresswoman Garcia again.
Yes, Mr. Chair, I would like to sponsor House Bill number 1748 on behalf of the authors and adopt their explanatory notes as their sponsorship message. Thank you, Mr. Chair.
Thank you. We now call on Congresswoman Cherise Ann Hernandez for House Bill number 2361 via Zoom. Congresswoman Hernandez.
Yes, Mr. Chair, good morning. Thank you very much. And to my dear colleagues, good morning. The Republic Act number 10152, or the mandatory Infants and Children Health Immunization Act of 2011, was enacted more than a decade ago. Nothing less than the pandemic reminds us that the new diseases and viruses emerge. Time has passed, okay? New diseases turned up, and vaccines to prevent new and old diseases become available. Unfortunately, some of these vaccines cost thousands of pesos per shot, which some parents cannot afford. Suffice to say, new parents now have a long list of vaccine expenses for their babies compared to those 12 years ago. At present, only 9 vaccines are mandated by law to be given for free at government hospitals and health centers. These are the following vaccine-preventable diseases: tuberculosis, diphtheria, tetanus and pertussis, poliomyelitis, measles, mumps, rubella or German measles, hepatitis B, and H influenza type B, HIV. House Bill number 23616 to include rotavirus, Japanese encephalitis, pneumococcal conjugate vaccine, human papillomavirus, hepatitis A, varicella, and flu vaccines to the list of vaccines given for free at government hospitals and health centers to infants and children up to 5 years of age. These are recommended vaccines for infants and toddlers commonly prescribed by pediatricians, which the underprivileged parents cannot afford usually. By including this additional vaccine-preventable diseases of infant in the list under the mandatory Infants and Children Health Immunization Act, we could attain herd immunity against these vaccine-preventable diseases. We also provide equal opportunity to poor families to have their infants and toddlers get vaccinated for free as we invest in the health of the children who are the future stewards of our country. Thank you, Mr. Chair. Good morning again.
Thank you. May I just clarify, Congresswoman Hernandez, your House Bill number is 2361?
Yes, Mr. Chair.
2361. Okay, thank you, Congresswoman Hernandez. We now call on Congresswoman Ruth Mariano Hernandez for her sponsorship speech on House Bill number 4483.
Thank you, Mr. Chair. and to the esteemed members of this committee and to the resource persons present today. Magandang umaga po sa ating lahat. I sponsor and present to this honorable committee House Bill number 4483, seeking to establish a national immunization program under the Department of Health, which shall ensure that our populace is equitably protected from vaccine-preventable diseases that can cause disability or death through an integrated and comprehensive immunization program for all life stages. This legislative measure is a refiled version of House Bill 8558 and has already passed the third reading in the 18th Congress, but due to the lack of time, was not passed into law. In consideration of time, Mr. Chair, let the explanatory note of House Bill 4483 be my sponsorship speech, and I wish for the committee's approval of this measure. Thank you very much, Mr. Chair, and to my dear colleagues in this committee, maraming salamat po. Magandang umaga po sa inyong lahat.
Thank you, Vice Chair Hernandez. We now call on Congresswoman Garcia to sponsor in behalf of Representative Gaston Bunting, House Bill 5061, and also in behalf of Congressman Patrick Michael Vargas on House Bill 5924.
Yes,
Congresswoman Garcia.
Yes, Mr. Chair, I would like to sponsor House Bill number 5061 on behalf of Congressman Gasta Bunting and adopt his explanatory note as his sponsorship message. Likewise, I would like to sponsor House Bill number 5924 on behalf of Congressman Patrick Michael Vargas, and again adopt his explanatory note as his sponsorship message. Thank you, Mr. Chair.
Thank you, Congresswoman Garcia. May we call now on our resource person from the Department of Health, Yusek Bev.
Thank you, Chair. The Department of Health fully supports these initiatives. The Philippines has faced multiple outbreaks for vaccine-preventable diseases, such as measles, rubella, and polio during the past decade. And this was a result of low immunization coverage rates, leading to an increase in the number of susceptible cohorts. For the past 5 years, the coverage of fully immunized children only ranged from 60 to 70%. That means around 700,000 children annually miss their routine vaccines, and that more than 3 million children under 5 years old as of this time are projected to be susceptible to measles and other vaccine-preventable diseases. The projected number exceeds one birth cohort or napanganak sa isang buong taon, and as such already signifies that an outbreak is likely to ensue soon. Because of this, expanding the vaccination of children with vaccines against the most common vaccine-preventable diseases will curb the transmission of infectious microorganisms and eventually assist in our long-term goal of healthy Filipinos who are protected against VPDs and also are able to achieve their fullest potential. With this, we support the initiative from the House. Further, the DOH would like to offer some more recommendations for the kind consideration of the authors. First is to have stronger mandates for our LGUs to fully implement the National Immunization Program by investing on needed human resource for health and public health facilities and implementation of localized health promotion strategy. Second, to provide stronger mandates for DepEd, SHED, and TESDA to include health education and promotion of immunization in school curricula or school activities, whether in grade school, colleges, or universities. Third, to provide a streamlined procurement process that will allow multi-year contracting for the procurement of vaccines. Fourth, to mandate our DICT to support the development of an integrated electronic information system designed to monitor and track all eligible populations nationally. This would include systems that encompass the national government as well as all LGUs. Fifth, to provide resources to modernize our vaccine supply cold chain infrastructure, and supply chain management, both at the national and local levels, and to ensure efficient storage, distribution, handling, stock management, and logistics of vaccines. 6, to expand the types of health professionals who can administer vaccines, now to include pharmacists, apart from the normal nurses, physicians, and midwives, and to emphasize the role of our BHWs in the immunization program. 7th, to develop a coordinated system of incentives and disincentives among various government agencies for our parents and caregivers. And finally, perhaps to consider including some form of penalties for parents or caregivers who, after due notice, consciously neglects their duty to provide their children utmost protection from vaccine-preventable diseases. For your consideration po. Thank you.
Thank you. Yusek Beverly, are you suggesting that BHW be allowed to administer vaccines?
Probably not, sir, because they will need significantly more training, and we don't have basic entry level for our BHWs.
So it's no.
No po. It's more pharmacist, sir. But for the BHW to really have a stronger role in navigating the patients and referring them to the facilities for the vaccination.
Are pharmacists trained to administer vaccines or any form of medicines?
Currently, sir, they're only with training, they're only allowed to do it for adults. So the provisions could be that they could have specific training and they will now be allowed for children.
So adults, all kinds of medicine, injectable medicines,
Opo.
pharmacists. Okay.
But not all pa rin, sir. Dun sa law nila, kailangan they have specific immunization training.
Training. Okay. Thank you. From the FDA, Dr. Pinion.
Good morning, Mr. Chair. I'm Lynette Carubin from the Food and Drug Administration. And I would like to manifest that the FDA fully supports the proposed bills, and FDA can facilitate the registration process of vaccines under the DOH's immunization program, and also supports the inspection of facilities and warehouses to ensure the compliance on cold chain, since most of the vaccines requires 2 to 8 or lower temperature. Thank you.
Thank you, Ms. Kerubin.
DOST, sir.
From the Department of Science and Technology, Ms. Yulian Garcia. Ms. Garcia.
Yes, the Department of Science and Technology, Philippine Council of Research and Development will support the bill and move forward by consultations. For request that we will submit our position to the committee once signed by our secretary. Thank you.
Thank you. Sino pa?
Philippine Pharmacists Association.
From the Philippine Pharmacist Association, Miss Sanhai. Sanhai.
Okay, good morning, Mr. Chair. So from the Philippine Pharmacists Association would like to express our support for these 8 bills being discussed this morning, and we always are in an end-to-end support and with the national vaccination program, especially during the time of the pandemic, and we will continue to support this cause to ensure safe, effective, and sustainable vaccination programs across all ages. And with the 14 identified vaccines now being discussed this morning, so we are currently, actually, we have this being authorized to administer vaccines under Section 4, Article 1 of the Republic Act 10918, called the Pharmacy Law. But this is only limited to adult vaccines. No, so this is under or after being certified through our immunizing pharmacy certification program, being done by the Philippine Pharmacists Association in, of course, collaboration with the PRC of the Professional Regulations Commission. And with this, I would like also to propose that we have to be included in the implementation of these bills, and to also have, we want to be supported on this in our training programs. And as of the moment, we only have around more than 1,000 of trained pharmacists, as we just started last April 2021 with our training program for adult vaccinations. And there are only 400 Department of Health pharmacists being trained or certified as of now. So to increase the coverage of vaccinations, so this proposal is being expressed this morning by the Philippine Pharmacists Association.
Thank you.
Thank you.
Thank you very much, Ma'am Hilda. Just a clarification. Because the immunization program will be largely directed to children and infants, I would say how many percent compared to adults? More than 50%, I would think. So, but in the case of the pharmacists, they are trained only for adults. So may I hear from the DOH if are we capable of training pharmacists to train them to administer vaccines to children and infants?
Sir, in fact, it's also through the work of the pharmacists that they're able to train their fellow pharmacists for adult immunization. So definitely we want to collaborate with them to develop a program to train young pharmacists to administer for children po. So we'll work together po, sir.
So the pharmacists are also in agreement that they will be all willing to train to administer vaccines, especially to children, because the majority of the target population will be under the below 18. I would think. Thank you very much. Yes.
Yeah. Definitely, we are into that. No, we want to, as I said a while ago, we want to be part of the implementation of this law. So we will support.
Thank you. May we hear now from vaccinations? Ito? Yes, sir. From Dr. Maria Rosario Capeding, my former colleague in a private hospital. Dr. Capeding.
Doctor, if I may, Your Honor, I am Professor Lulu Bravo. I'm representing the Philippine Foundation for Vaccination.
Okay. Instead of Dr. Capeding, my former professor, Dr. Lulu Bravo. You are now recognized.
Well, thank you very much, Your Honor. I would like to open up our position by saying that vaccination has been here for 230 years when it was started in England in 1798. In the Philippines, our official national immunization program was started in 1976, but we have been observing and gaining some lessons from our EPI program, or the expanded program of immunization, since 1974. So you can see it's been here for 50 years almost. And through those years, we have gained a lot of lessons. And from what our good representative Mike Tan said, big lessons have been learned from the dengue vaccine and the COVID pandemic that has occurred in the last 4 or 5 years. Your Honor, we appreciate and we support wholeheartedly the various bills that have been presented by Representative Mike Tan, the bills numbering 414, 1092, 1748, and 4483 by the various representatives, we do appreciate and support the expansion of our mandatory act because we believe that through the years, 230 years, we do need to get more new vaccines into the national immunization program. We do appreciate the fact, however, that a good, distinguished, independent body that would look at all the necessary data, knowledge should be in place as also provided by the bills that have been placed specifically. We support the formation of an independent NITAG or National Immunization Technical Advisory Group that will be composed of distinguished, competent, honest, transparent clinicians, academicians, researchers, scientists with various specialties in pediatrics, microbiology, public health, health economists, internists, and the addition maybe of course representatives from the other private sector, maybe not voting, but industry should also be represented in order to tell us the recent most advanced composition of the new vaccines. We believe that only through an independent body that would be created outside the Department of Health, just like what they have in the United States. And this is called the ACIP, the American Committee on Immunization Practices, that is not under the health services, but under the CDC. It's under the research, the Center for Disease Control. It is where the debates, the arguments, the agreements, disagreements, all the data are being presented for these scientists and academicians and researchers to ponder and to make the necessary recommendations that will give the Department of Health and the Secretary of Health the wisdom to be able to make the necessary final decision to approve what vaccines to be given, what priorities to be given, what age groups and what sectors of society need to be given these vaccines. As we all know, Your Honor, vaccinology is a very complicated subject. It is not for the ordinary, even not ordinary doctors would be able to imbibe. I have been studying vaccine for almost 50 years now. Mind you, my first research in pediatrics was to look at the immunization program of the Department of Health in 1974. And through the years, we have established the Philippine Foundation for Vaccination, which actually was an inspiration brought about by the Gavi, the Global Alliance for Vaccine Initiative, and by the inspiration brought by Senator, then Secretary of Health, Juan Flavier, who made it possible for us to have a catch-up vaccination in the 90s that made our country an envy of the Asian region because we were able to acquire and achieve almost a 95% immunization coverage, which is really unheard of at this time. Dr. Beverly Ho said we are only at 50% and we are now threatened by measles, by polio, which is so embarrassing because we have already eradicated polio and we were at the midst of measles elimination. But because of the Dengvaxia, because of the COVID pandemic, our vaccination coverage is down. And we need all the experts to help us to be able to rise from this and be able to gain the vaccine confidence that we used to have, which was 93% at that time in 2015, which went down in 2018 to only 32%. Your Honor, this is really very disappointing, but I believe that with your Congress, with your help to establish the experts that will bring about a new era in recommending new vaccines, recommending the necessary prioritization, because we cannot just buy and buy vaccines without looking at what we really need at the moment. Because even our colleague says we do need to improve first our catch-up vaccination. Dr. Beverly Ho said we need the system to be in place so that all the resources, all the needed help from the LGUs would be there to avoid a very embarrassing situation where we will have a lot of polio, measles, and God forbid, even outbreaks of dengue right and left. Did you know that, Your Honor, that we have the highest incidence of dengue, meningitis in the Asia Pacific region? And we hope that we will be able to overcome this with your congressional support for a mandatory childhood vaccination that will make our economy boosted and tourism even, because a country that does not support immunization and the health of our children will never progress in terms of our health and economic status. Thank you very much, Your Honor.
Thank you very much, Dr. Bravo. We are one with you, and we commit our support for this mandatory immunization. Thank you, Professor Bravo. We now call on Dr. Remonte from the PhilHealth.
Good morning, Mr. Chair. Good morning, honorable members of this committee. We will still be submitting our position paper.
Okay, but are you in support of the bill?
But immunization law, the immunization is considered.
Sorry, can you please repeat your statement?
Can you hear me, sir?
Yes, you're now clear and
okay.
loud.
Good morning, Mr. Chair. Good morning, members of this honorable committee. We will still be submitting our position paper, but for us, immunization is an individual-based services, so PhilHealth can indeed support these services as part of its benefit packages. As of now, we are supporting partly this through our newborn care package, since we cover the initial dose of hepatitis B and BCG vaccine. However, whatever is there, it will be aligned with the Universal Healthcare Act and PhilHealth mandates, including the health technology assessment, and we should also be considering the resources available within PhilHealth. So thank you, Mr. Chair. We will be submitting for our position paper later. Over.
Thank you very much. When will you be able to submit your official position paper? Ms. Rimonte? Nawala. At this point, we'd like to acknowledge the members of the committee who are physically present. Honorable Bonifacio Bosita, Honorable Agustina Dominic Pancho, of course, Honorable Stella Kimbo, and on Zoom, Honorable Faustino Michael Carlos D. the third, and Honorable Franz Promaren.
Nurses Association, sir.
May we call now the representative from the Philippine Nurses Association, Governor Melvin Miranda.
Thank you very much for the recognition. Good morning, Honorable Chair and the members of the committee. We will be subject for the submission of the official position paper. However, the Philippine Nurses Association, as the accredited professional organization of nurses, fully support these endeavors because the nurses have been involved in the National Immunization Program and expanded program for immunization since 1970s. And indeed, to the DOH have considered our association and our profession as an arm to fully implement efficiently and effectively the National Immunization Program to the grassroots. And through this mandatory immunization program, the Philippine Nurses Association, along with our Filipino nurses, have acknowledged and recognized the proposed bill that will that have been considered in the creation of the National Immunization Technical and Advisory Group as participant of the composition of experts from the fields of pediatrics, infectious diseases, epidemiology, public health, health economy, and as an affiliate agencies. We fully support the mandatory immunization bill, sir. Thank you so much.
Thank you, sir. From the UP National Institute of Health, Dr. Maria Esterlita Uy.
Hello, good morning. I'm representing the National Institutes of Health. Thank you for this opportunity for us to share our comments or considerations for this bill. NIH has provided baseline epidemiologic studies in several vaccine-preventable diseases such as hepatitis B, German measles, Japanese B encephalitis, and rotavirus. We have actually provided evidence that there was a significant reduction in diarrheal diseases after the introduction of the rotaviral vaccine, specifically in Agusan. We've also provided evidence in the cost-effectiveness of rotavirus and human papilloma virus vaccinations. So we are currently conducting a study on the delivery cost of the human papilloma virus vaccine, since we know that this was initially a school-based program, but because of the pandemic, it became a community-based program. So we welcome this new House bill in expanding the immunization, but with your permission, I would like to forward some concerns. So I'm happy actually to see that House Bill 2361 has included chickenpox or varicella vaccine, hepatitis A vaccine, as well as the flu vaccine. I would like to ask you and my other colleagues about the inclusion of the meningococcal vaccine. We can still remember the meningococcal epidemic, which happened in Baguio several years ago, which led to a lot of deaths in Baguio. So I was wondering if this could also be included in the expanded immunization. I also acknowledge that this is limited to only children, but some of the adult vaccinations are for the protection of children. For instance, the German measles vaccine or the rubella vaccine, we know that if a pregnant woman is infected with the German measles, especially in the first trimester, the baby will have some congenital anomalies like cataract, heart problems, a small head, and even death. So I was thinking, even if it is of a vaccine for adults, then it can actually protect the children. If we could actually, it says here it's only 0 to 11 years old, but the MMR, which includes the rubella vaccine, is recommended also for women of childbearing age. So even the adolescents will actually benefit from this. My last comment is about the pharmacies giving the vaccination. I'm actually a pediatrician together with my colleagues here. When we do immunizations on the children, especially among infants, we actually couple this with a well baby checkup. We check the baby, how the baby is doing or growing. We also do developmental assessment on the babies. So if this will be given to the pharmacies, then the children may not go to us, and so the babies will not be assessed anymore. So I am thinking, I think for children, since the vaccine is coupled with the well baby checkup, I think we will miss the opportunity to see the babies during infancy or up to 2 years old. We know that during the pandemic, a lot of children were not seen by pediatricians, and now that we're actually doing face-to-face, we see a lot of babies or children with some developmental delay and etc., which we will miss if we give the vaccination job to pharmacists, because we will miss this. I also welcome the inclusion of the immunization as a PhilHealth package. So I think those are our concerns. I'm actually with our colleagues from the vaccine study group of the NIH, as well as the Philippine Foundation for Vaccines. So I would like to, with your permission, sir, Chair, I would like to pass the mic to my colleague, Dr. Marimel Pagkatipunan and Dr. Joanne Castro.
Thank you very much, Dr. Villanueva. Dr. Pagkatipunan, for your brief comment.
Good morning, everyone. So I'm representing also the pediatric infectious disease specialist of the Philippines, and the Philippine Pediatric Society of the Philippines. So with this, we already have a position paper actually submitted before in 2019 for the bill. And in that position paper, we actually support the expansion of the NIP, or the inclusion of more vaccines for infants and children. The only comment that we have is that we have to have that NITAG, or the National Immunization Technical Working Group, which should be composed of the different stakeholders who are experts in the vaccination, and that would include our societies. So we also have in our society the annual review of all this infant and childhood immunization. And we come out every year with a recommendation for all of these vaccines. That includes if there are also new vaccines that come out in the market. So I think that that is part of the bill that the sole decision for the inclusion of these new vaccines should be on the DOH under the NITAG recommendation, so that it will be more timely. For example, like what we did with COVID vaccine for children, so that the process will have to be followed, and it does not have to be under the law or the bill. So I think that's one of the comment for the society. But we have the position letter to be submitted to you, sir. Thank you.
Thank you, Doctora. From the Doctora. Sorry, please identify
Dr. De
yourself.
Castro. We have
Dr.
the
De
same.
Castro.
We have the same comment. I also represent the Philippine Pediatric Society and the Pediatric Infectious Disease Society of the Philippines. So same comment. Thank you.
Okay, thank you very much. We now hear from the Philippine Medical Association, President Dr. Ervi Kalimag.
Good morning, Honorable Chair and members of the Committee on Health. Just like to note that under the section on the creation of the NITAG, I think the Philippine Medical Association was inadvertently missed. You have there the Philippine Nurses Association and the Philippine Pharmacists Association. Actually, we have 119 component societies in all 17 regions of the country and different provinces. And it was the Philippine Medical Association that actually took charge of the immunization initiatives during the COVID pandemic. And for that, we were recognized by the Office of the President. And also a point of clarification regarding the functions of the formulary executive. It is supposed to be a committee under the Department of Health. It's not a council, but the functions of which have been subsumed by the Health Technology Assessment Council under the Republic Act 11223 or the Universal Healthcare Act. So should we place HTAC instead of Formulary Executive Committee under this provision, also for your consideration, sirs? I think the Health Technology Assessment Council is set to also submit a position statement regarding this po. Thank you very much. Please, for the inclusion of the Philippine Medical Association, sir.
Thank you very much, President Kalimag. May we hear a reaction from the Department of Health? Yusek Bev?
Thank you, Chair. Chair, we will be providing you more detailed comments regarding the governance structure, but we do agree that we have to take into account yung existing bodies that have been put forward in certain legislations like the HTAC as well as the National Practice Guidelines program. So parang we just have to situate all of these po. Thank you.
Thank you, Yusek Bev.
Sorry. Pediatric Society, sir.
From the Philippine Pediatric Society, Dr. Florentina T. Siya ba yun?
I was asked to represent PPS.
Okay.
So, same.
Okay, thank you, Doctora.
In infectious disease.
From the Philippine Infectious Disease Society of the Philippines, Dr. Fatima Jimenez.
Sir, we already represented her. Thank you.
Okay. Thank you. From the Philippine College of Physicians, Dr. Solante.
Sir, we support the stand of the Philippine Foundation for Vaccination as mentioned by Dr. Lulu Bravo. Thank you.
Thank you, Dr. Solante. Any more? Wala na. Okay na.
Nothing more. Okay na, sir.
Doctor, ano?
Okay na po for the members.
Yes, salamat, Mr. Chair. And of course, good morning po sa lahat. My first question has to do with the mandatory nature of the program. Ano po ang target population natin? So when you say mandatory, it's mandatory for what age groups? Is there a recommendation from DOH? Because you all expressed full support for the bill.
Yusek Bev from the
Thank you.
Department
Good
of Health.
morning po. Ma'am, yung most critical for us is vaccines for 0 to 5 years old po.
Right, so shouldn't you include the target population in the bill? I mean, ang hirap nito kasi pag sinabing mandatory immunization, is this all Filipinos?
In the bill, if I may answer, Congresswoman Kimbo, in the bill, it includes all qualified population, target population from infants, children, and adults, all life stages.
Okay, so all Filipinos.
Yeah, all Filipinos that are qualified. Of course, there are exemptions to those who cannot receive
Yes.
vaccination.
Well, the reason for why I asked that is because there is an appropriation provision. So syempre, taon-taon magko-compute tayo ng budgetary requirement. So dapat sa aking palagay, dapat merong lengguwahe dito sa panukala kung sino bang sakop. Kasi magko-compute po tayo ng budget. So ang hirap naman po on the part of the DOH kung anong ilalagay nila sa budget call. Kung hindi tayo sigurado kung ilan po ang sakop dito sa programa. So that's my first.
All qualified in the target population. And the target population in our briefing yesterday with the DOH is 95%. It's not 100%. It's 95% of the total target population. Am I correct? I think Dr. Tejada was with us yesterday. Yusek Beb?
Yes, sir, we agree po. And we also note that there are really huge budget implications. So for example, when we did the rough calculation, just by adding all of the vaccines that are proposed here, yung indicative rough vaccines pa lang from the current na almost just 5 to 7 billion that is being appropriated, it will balloon to around 24 billion kasi. So we agree po with Congresswoman Stella that there will really be budget implications. And this still does not include, of course, the ancillaries, the support staff needed to administer. Thank you po.
All right. Salamat for that clarification. My next question is, how do we mandate? So earlier, a resource person said that in recent times, the all-time low is 32% immunization rate. In short, nagkaroon ng maraming agam-agam sa pagtanggap ng bakuna because of some issues, right? We had the same issue initially with COVID, but then I think kahit paano we were able to address that concern at mataas ng ating immunization rate for COVID. But gayon pa man, meron pa rin tayong anti-vaxxers. I mean, and I realize that the anti-vaxxers are also among the medical practitioners. Hindi lang po among those to be vaccinated, but also among the practitioners. So I was looking at the bill. Of course, there are mechanisms to promote immunization. Nandito po yung education, which is good, etc. But realistically, how do we achieve a 95% mandatory immunization rate? So parang hindi masyado pang clear, at least to me, kung ano yung pinaka-powerful na mechanisms na yan. Like halimbawa, of course, this could be extreme, pero meron bang penal provisions? I mean, are all doctors therefore mandated na kapag meron silang pasyente at kaharap nila yung sinasabi ni Chair Gato na qualified beneficiary, at kung yung doktor na yan ay mismo ang anti-vaxxer at ayaw niyang turukan ang kanyang pasyente, may implication ba yon? So I'm not suggesting one way or another. I'm just saying that we need to face the reality that there are anti-vaxxers, right? And right now, are there sufficient mechanisms in the bill that will allow us to achieve a 95% immunization rate?
Before the DOH, may I had this information during our briefing yesterday. I learned that before the Dengvaxia issue, we were already about 80% successful. In other words, the acceptance rate of our immunization program was around 80%. And then in 2017 to 2022, it went down to between 60 to 69%. But now I heard from Dr. Bravo, it's 32%. And then this morning, I heard from the USEC, it's 70%. So baka depende siguro sa vaccine. I don't know. Maybe the Department of Health can help clarify this iba-ibang figures.
Yes, Chair. So actually, when we looked at our immunization rates, fully immunized child coverage rates from 2012 to 2021, parang it really goes 75% to around 63%. Yun yung range po. I think yung 32% po na na-mention kanina, if I remember it right, it was in a vaccine confidence survey. So hindi po siya yung actual results ng immunization program, kundi confidence po. So it went to an all-time low of 32%, then went up alongside yung COVID deployment. So ngayon, yung confidence rate is back to around 70 to 80%. Pero never po tayo nagkaroon ng year na 32% lang yung vaccinated na bata.
Have we reached 80% or maximum of 70%? Because
Sir,
our target is 95%.
Sir, in the past 10 years, yung 2012 po yung pinakamata. 2014, 75.4%.
Yeah. I mean, after the Denvaxia issue, the highest as of yesterday's briefing was 69%.
Yes, sir, 69%.
Okay. May we know how many millions at present ang target population natin sa infants and children? Meron ba tayong figure?
Sir, 2.1 million po.
2.1 million. With the approval of this bill, assuming na this will be enacted into law, our target population will now be how many million? That will include the adults.
Sir, maybe we'll need to get back to you on that kasi hindi po kami ever nag-compute for entire adult population in any of our adult immunization program po because of budget constraints. Kasi po, kunwari flu vaccines and PCV for adults, we really only do senior citizens and sometimes indigent kasi hindi po talaga kaya
But
sa
in the
budget.
bills today for deliberation, nakalagay dito ay all. That includes children and adults. So I assume na you have already projected how many millions?
Sir, we actually did not project for the entire population kasi parang sobrang laki po talaga niya. So siguro we'll get back to you na lang po, sir, on the
Well, that was
calculation.
precisely why I asked the first question.
Because the next question will be how much is the estimate cost, assuming that this bill will be enacted
Yes.
into law.
But
Kasi right now we have 5.9 billion for 2023.
Yes,
And
sir.
your projection is around 24 or is it 36 billion?
24 billion for vaccines alone, sir. And then with ancillaries, HRH, etc., that would go to around 41 po. But this would include only infant, school-age children, and elderly pa lang.
Elderly.
Opo, ito pa
So,
lang po yung kasama.
Hindi all adults.
Hindi pa po, sir.
So Congresswoman Kimbong.
all right, before I ask questions on appropriations, I will return to this mandatory nature. So again, in light of this mandatory nature, ano yung treatment po doon sa ayaw?
Yeah.
I mean, as you move forward and implement a mandatory immunization program, and of course, we will encounter people who either refuse to accept or refuse to administer. What is the treatment of such individuals? Kasi mabigat yung salitang mandatory, di ba?
In our briefing yesterday with the DOH, I was also asking the same question, including the title, mandatory. When we say mandatory, what does it mean to say when you say mandatory, mayroon bang penalty? What are we going to do with those who refuse vaccination? Especially kasi ang reasoning was we need to improve on the information, education, etc. And we understand that. But how about medical practitioners? How about supposedly educated, PhDs, professors, high government officials. What are we going to do with this with them? That was my question yesterday, and medyo open-ended ang ano. Some would say mas ano, lagyan ng penalty clause. Some would say otherwise. Yes, from the Philippine from the
Yes, sir.
NIH,
Dr.
Doctora.
Paketipunan po. So I think the context of those who doesn't want to have the vaccine, not in the globally, no, we cannot vaccinate all of the individuals because there are some contraindications to the vaccines also for some individuals, like those who are immunocompromised. You cannot give them all the live vaccines or all the recommended vaccines. That's why we have it as recommendation for the vaccines. And then there's also the thing that we cannot assure that if you are really vaccinated, you will have the 100% efficacy or effectiveness of that vaccine. So that's a given fact for vaccination. But we aim to have the very high coverage that is 95% for all of as much as possible for all of these vaccines to be able to achieve that herd immunity. So those who herd immunity, so that those who cannot be vaccinated can also be protected because all of those around her or him are already protected. So I think in that context, no, we can consider that, and even for some type of vaccines, like for example, our hepatitis B vaccine, 10% of the population are non-responders to the vaccine, even if you give them so many doses of the vaccine. So so that I think should be the one of the contexts that we just aim for the highest possible percentage of coverage for the vaccines.
Yusek Bev.
Thank you, sir. Sir, I think yung title lang for one, I think it's really because the 2011 law that this is amending is already entitled mandatory. Kaya I think it's the word is here. In our position paper, we'd also like to emphasize that yun nga, when we were having internal discussions with the PPS, sabi din, there has long been parang soft mandate. But since it didn't have much provisions on penalties, yung former na batas, and then parang there's really no implication for not supporting the vaccination. So based on our literature review lang po, the other countries do have a mix of incentives and disincentives in place. So kunwari po, in the European countries like France or Australia, they put up fines, so penalties for whether the caregivers, the parents, or even the providers, even those who spread misinformation. And then for the incentives and disincentives, they link, well, syempre the other countries have better childcare subsidies, etc. So they link it with access to those benefits in order if you get your child immunized. Pero kung hindi, you don't have access to those benefits. Over po.
Yes,
Congresswoman
yes.
Kimbo.
So, Mr. Chair, under the current law, which is entitled Mandatory Infants and Children Health Immunization Act of 2011, mandatory under the current law. Ano ang pagpapatupad ng DOH dito po sa mandatory nature para sa immunization ng bata?
Ma'am, wala po rin talaga kasing penalty. So walang
So in other
real
words, hindi talaga siya
implication.
mandatory
Yes po.
in that sense. Kasi marami talagang nakakalusot. Like, in fact, the dengue vaccine happened after 2011 at dito nagkaroon ng all-time low na 32%. Wala naman tayong implication, right? So, yun lang, Mr. Chair, sana pag-aralan natin or kung may recommendation ng DOH kung are we going to keep the mandatory nature of the program If so, how will we implement it? Or kung hindi naman mandatory, what is the alternative? But at the same time, we achieve the same desired result. So that's my first recommendation, Mr. Chair. My second question has to do with financing. Dito po sa section 4, so this is on page 2, line 18, lines 18 to 22 refers to PhilHealth, right? So kasama po dito sa panukala, PhilHealth shall include the mandatory immunization services specified under this act. So again, babalik tayo sa, well, una sa lahat, medyo there are two seeming contradictory provisions. On one hand, pinapakarga natin sa PhilHealth ang budget nito. On the other hand, merong appropriation cover, right? Which means national budget ang gagastos po dyan. So we need clarification on that. But more importantly, kasi conceptually, pag sinabi mong mandatory immunization, that's not an insurable risk. Alam natin that PhilHealth is an insurance program. It provides benefit payments for illnesses that are subject to risk. Yun ang nature ng insurance. Hindi mo maprepredict kung magkakaroon ka ng pneumonia, etc. Therefore, babayad ka ng premium, nakakompute sa premium yung probability ng mga sakit na yan, etc. Pero pag sinabi mo yung mandatory immunization, ikakarga mo sa PhilHealth, malaking implication noon sa premiums. So have you, and you've already said you fully support the bill, have you looked into this? So number one, I assume that sinusuportahan ninyo na ikarga sa PhilHealth. But number two, kinompute nyo na ba ang magiging dagdag na premium pag sinama natin ang immunization dito sa PhilHealth benefits, right? Number three, we also heard PhilHealth say that they support it. Kung hindi tayo makakapagtaas ng premiums, because that seems to be the situation today, di ba? Meron ngang mga sinasabi na the president will suspend, di ba? Or has already suspended the premium hike. So obviously there is no appetite for the increase in premium. So in which case, ibabawas yan ng PhilHealth sa kanilang reserves. Eh ang sabi natin, 41 billion ang kailangan natin, hindi pa kasama ang working age population. So kahit nasabihin natin na ang reserves ng PhilHealth ay nasa 200 billion, kinargan nyo na dyan ang konsulta, ikakargan nyo pa ang National Immunization Program, magsasara na ang PhilHealth bukas. Hindi po ba? So in your statement, fully supporting the bill without mention of this, what is your assessment? Ano ba dapat ang tamang pag-finance ng isang mandatory national immunization program?
Yusek Bev.
Ma'am, so from our end, our specific position is that we understand that at this point, parang hindi siya kaya, and that's why it's always still carried in the national budget of the DOH. If any po, our short-term goal is really to just be included as part of the performance incentives of the primary care package that PhilHealth will be rolling out. Kasi part and parcel naman to of really the services in primary care benefits. And we do agree with you that it will take a more specific study to cost it out and include it in the PhilHealth benefits, especially considering hindi tayo makataas ng benefit package. Tsaka ma'am, siguro parang most of our inputs are still not in the substitute bill. So we were also just in a meeting yesterday. So not everything is here yet. Papa.
Yes, but Mr. Chair, I think this is a very important issue. And it will have implications on the entire social health insurance program. It looks harmless, but it is not harmless because I think it deserves more study. You need to really give us what you think about lines 18 to 19 of section 4, whether you agree that it has to be included in the PhilHealth benefit packages. That's very important. And And then I move on to appropriation. So you said earlier that you need 41 billion that excludes the working age population. So pretty much you're looking at about 100 billion, more or less, to cover 95% of Filipinos. And it's unclear to all of us yet how mandatory shall be implemented. What will be your recommended or what will be your proposed budgetary requirement? Alam na natin na malapit na ang budget call. I'm sure kinukulit na kayo ng DBM. And is this something that you will already include in your 2024 proposed budget, considering that it is clearly an important bill? And if so, how will you compute? Kasi nga, we're looking at 75% vax rate today. The target is 95%. Are you already computing the budgetary requirements to be included for the 2024 budget call?
I think, ma'am, quite realistically, from the DOH program side, we do have appropriations for our vaccines ngayon. Yung totoong important na target for us is whatever vaccines that we're buying now, hindi pa yung expanded that is in the bill, we get to 90% at the very least, 95%, di ba? And to get to that is already been a big feat, a stretch already to work with the LGU. So, kasi ma'am, parang hindi po namin plan pa na implement lahat ng nandito. Kasi based on our program, so for example, there's no bill. All of the vaccines that will be expanded here will really go through HTAC pa naman talaga, di ba? And we never proposed them earlier than when we actually already got HTA approval. So usually that's also our process for what we include in the budget call.
All right, so your current appropriation is how much? 5.9
5.9 billion.
And in 2022, how much was that? Which would be big because it included the COVID vaccines, right?
Ma'am, we just
You separated that.
Opo.
Okay, so excluding COVID.
In 2022, it was 5.5, and then in 2025.
Okay, so of that 5.5, how much did you utilize?
Ma'am, I'll just check lang po from our files.
I'm sure you have it top of mind.
Usually na 90%, more than 90% yung ano namin. Historical utilization namin is 95 to 98%.
Of the fund?
Yes, ma'am. Nabibili mo naman po talaga.
Okay, so last question, Mr. Chair. So we are currently at 75% vaccination rate. The aspiration is 95%. Is there anything in the bill that is new? In other words, obviously we need some marginal effort. We need to increase our effort to get from 75 to 95%, right? So what is it in this bill that assures all of us here that such increment can be achieved?
Ma'am, based on our position and review of the bill, what is critical for us is really more solid commitment from the LGU level. So meron kaming recommendation which is still not here. Some really statements to give more responsibility to LGUs, largely kasi HR and HR issues pa rin siya babalik. Second would be the system of incentives and disincentives, which would include the penalties, if ever.
Okay, so can you please further explain that? Health is a devolved service, and I believe that you've begun devolving, right? So in short, right now, well, at least in our district, parang raramdaman na ang pag-reduce ng support ng Central DOH because nga of devolution. So you're suggesting that some responsibilities be passed on to the LGUs, pero in the light of devolution, wala naman silang dagdag na support. Hindi ba dapat if ever you increase responsibilities for the LGUs, hindi ba dapat ang i-consider ninyo is more incentives. I mean, some kind of a matching grant, which works under a devolved setup, right? I think if you believe that it's really the LGUs that will be key to achieving a 95% vax rate, in a devolved setup, ang kailangan yung pag-isipan is an innovation on how you can incentivize. Ang tingin ko dyan is matching grants. So, palagay ko yan ang dapat ninyong isama sa inyong pag-aaral. And at the same time, if it does entail costs, yun ang dapat din isama, di ba, sa budget requirements, whether 2024 or whenever the bill gets passed into law. Anyway, so that's my final comment, Mr. Chair.
Thank you, Congressman Kimbo. My also in the briefing yesterday, I understand that the budgeting of the Department of Health entails from the purchase to the distribution up to the level of region, and in some provinces if they are considered GIDA. So the distribution in the provincial level and the administration napupunta na sa LGU. Is that correct? So in the cost estimate of budget, sinasama nyo ba yon up to the administration level or up to the distribution level lang?
Sir, up to the distribution level only, and yung support to LGUs will really on HR specifically will depend on their classification. So because of the Mandanas Garcia ruling, for example, this year, moving forward, only 4 to 6 class would usually get the full staff, additional staff complement. But yung 1st to 3rd class, medyo nag-withdraw na po.
So
ng
yung
support.
sinasabi ninyong how much is that? Is it 36 or 40B na estimate nyo?
41, sir.
41B. Hanggang ano lang yon? Hanggang distribution lang yon?
Sir, we actually added HRH here of 13 billion.
Added yung HRH na.
Opo.
But
Kasi
hindi-
yun talaga din yung feedback ng LGU na wala sila.
So kasama na doon sa LGU yung 13B?
Opo, dun sa 41 that we estimated,
okay.
we added 13 billion of HRH na bababa po sa LGU.
That will cover for the administration
Yes, sir.
down to the patient, to the recipient of the vaccine.
Yes, sir.
Okay, thank you. Before we proceed, we'd like to acknowledge the presence of Honorable Luz Mercado, Honorable Adrian J. Advincula, Honorable Midi Kua, and Honorable Romulo Kid Peña Jr. We now recognize Dr. Ana Ong Lim of the Philippine Pediatric Society.
Thank you, Mr. Chair, and thank you for giving the professional medical societies a voice in this hearing po. I'd like to just address some of the questions that were raised by Representative Kim po. I think these are really important questions, and thank you for asking them, because these have really been the problems that have been plaguing the program for quite some time. So I'd like to make some comments on the issues of the mandate, the covered populations, and the financing from a bigger picture perspective. I think we have to think about vaccination as a strategy, the target of which is decreasing the impact of infectious diseases. And I'm glad that we all agree that vaccination is important, which is why we're having this bill or these bills being proposed. But really, because we have very limited resources, we need to be very strategic when we think about vaccination programs. And I think the critical thing to emphasize in any bill that will be passed is to ensure that there is a surveillance provision that allows us to make informed choices about which vaccines to include. So, alinmang version ng bill ang maipapasa, kailangan pong malakas po yung provision on determining alin bang mga sakit ang kailangan nating matarget. So pangalawa po dito, yung question of sino ang magdidesisyon kung alin yung mga bakunang ipapasok. So this is a fairly technical concern, but I think it's very important for our lawmakers to understand that in many countries, meron pong tinatawag na National Immunization Technical Advisory Group that is independent of the Department of Health, na siya pong nagbibigay ng mga rekomendasyon base po dun sa mga nakakalap na datos sa bisa ng bakuna at saka dun po sa burden ng mga sakit na kumakalat. So sana po mas strengthen itong provision na ito. Maganda din po na magkaroon po ng flexibility yung bill na ipapasa. So currently yung language po na nakikita ko dun sa mga iba't ibang version saka dun sa matrix po na na-share sa amin, nakaspecify po na meron po mga bakunang kasama at meron po mga bagong gustong isama. I think this is tying our hands prematurely. As a clinician in infectious disease specialist, syempre gustong-gusto ko po maraming bakunang ipapasok. Pero paano po kung makalawa o sa susunod na taon, meron na namang bago o may kailangan na pong tanggalin. So siguro mas maganda pong mas strengthen na lamang yun pong provisions on surveillance, governance, at yun pong mga nababanggit po ni Representative Kim po na financing para po ma-achieve po natin yung target. Manasasabi po na napakababa ng ating coverage. The team of Dr. Tejano in the DOH shared with us a slide last year showing us na mas marami na po yung mga pinanganak na bata na hindi nabakunahan kaysa na nabakunahan. Yun po mga ganong numero, nakakasindak po yun. Kasi po, kung iisipin po natin, we are very ripe for another outbreak of these infectious diseases. So isa po sigurong punto na gusto ko pong i-raise is, aside from discussing additional antigens, kailangan po talaga natin ma-strengthen yung service delivery network, yung nababanggit po ni Representative Kim po na enabling the local government units to implement. Kasi po, bago pa po sana natin pag-usapan yung bagong idadagdag, kailangan pong magkaroon ng atensyon dun sa pag-deliver nung nasa programa na ngayon. At pangalawa po, makover po yung cohort na pinanganak noong 2020, 2021 at 2022 na halos hindi po nakatanggap ng mga bakunang dapat po nilang natanggap during their infancy. So each birth cohort is 2.7 million. So I leave it up to you to compute kung ilan po ang kailangan nating habulin. And wala po yatang provision or pondo sa ngayon for a catch-up program. Maraming salamat po.
Thank you, Dr. Lim. Congressman Violago.
Thank you very much, Mr. Chair. Good morning to our resource speakers and to my dear colleagues. Actually, marami ng questions na I'm supposed to ask kanina pero nabanggit na ni Representative Stella. Siguro isang ano na lang, no, nabanggit din naman ng Department of Health kanina na the most critical age is 0 to 5. No? Ako suggestion lang, why not we just concentrate muna do sa very serious na age bracket rather than covering all stage of life, no? So that total, I believe, parang mukha sana yung one step at a time, no? Yun yung suggestion ko. So in case na this substitute bill will be referred back to a technical working group, I suggest na siguro medyo himayin natin ng konti for para mas madaling ma-approve. Hindi lang as a law, kundi pati when it comes to financial support, mas madaling mapondohan ng ating gobyerno. Yun lang, Mr. Chair.
Thank you, Congressman Violago. May we ask any one of the authors to comment on the suggestion of Congressman Violago, limiting it for the meantime 0 to 5. Congressman Kari.
Good morning, Mr. Chair. I have no problem with the suggestion of my good colleague. Yun lang po. Wala po akong problema.
Mr. Chair.
Yes, Congresswoman Garcia.
Yes, I think the existing bill is already a mandatory immunization program for 0 to 5. So in line with the suggestion of Congressman Villago, maybe we can, if the authors agree, revert back to a technical working group on how to first analyze implementation of the existing bill, because we also want to know the accomplishments of the all the stakeholders from DOH to the LGUs of the existing bill, if the budgets are already enough just for the existing, in aid of improving and expanding to all life stages. That's siguro my first, if Congressman Villago could, we could amend that that motion. Second, maybe we can also request DOH to furnish us an accomplishment report on the immunization of the on the existing bill, so that we can be guided as lawmakers, especially in this committee. And then maybe third, from an LGU point of view, the devolution is a much gasgas na
Abuse.
na
Word.
salita, especially from an LGU point of view. And I always point it out that the Garcia Mandanas ruling has nothing to do with devolution. It is a correction on the computation of the just share of the LGUs. So maybe also we can request, if the spearhead department is DOH, if we really rely on the LGUs for the much needed implementation arm of this existing bill and the proposed bills, maybe we can also put in an amount or a budget, because in the end, maybe the increase in the NATA is not even sufficient to cover all the things that we are saying, that the Garcia Mandanas has given that burden. It's not supposed to be a burden. It's supposed to be a correction on the allotment of the LGUs. Yun lang po, Mr. Chair.
Thank you, Congresswoman Garcia.
Mr. Chair,
Yes, Congresswoman
before the
Kimbo.
DOH responds, siguro very ano lang, just a clarification. If this is going to be called a national immunization program, does that mean hindi siya made-devolve? I mean, di ba? In which case, kasi national program eh. So, yung vaccine lang. So, yung ancillary, yung implementation,
Hanggang distribution lang. Hanggang
LGU.
distribution
Ganun
lang
ang
sila.
Yung vaccine lang.
Diba? So,
Hanggang distribution lang.
ay, problema talaga si 95%.
Yes.
Yeah, that's why you really need to you need to support the LGU, because otherwise, anyway, sige.
Yeah, Mr. Chair.
Yes,
Actually,
Congressman
tama
Villago.
si Representative Stella, no? Imagine na lang sa COVID, ano? Yung first year niyo parang less than 50% kayo. It only went up to 70% when the LGU came up with incentives, no? And now we are talking of what, 13 vaccines. Nag-usap nga kami ni Congressia. Sabi ko nga magana yung braso mo pag sinaksak lahat ng 13 na to, no? So imagine, ibig sabihin ba, para may saksak natin yung 19 na yun eh. Lahat, every vaccine, kailangan may incentive tayo. Just to convince the people na matake nila itong 13. More than 13, if I'm not mistaken, Mr. Chair.
Thank you. Kong Villago. The 30 naman, hindi naman necessarily ibibigay lahat yon sa isang tao. Yeah, I can see your point. Yeah. May we hear from the Department of Health?
There has already been a review done. Maybe we can just share it with the body po by NEDA, Philippine Institute for Development Studies, regarding the National Immunization Program. It was released last year po. So it was a 5-year review of all the components of the program. Maybe share na lang po namin. Thanks.
Or
But Mr. Chair, that report will not include the effects of devolution or partial devolution. I think that's the most important issue today. Kasi if you're going to insist na devolve ka, and besides, saan yung definition na ganon yung hati? If it's a national program, kasi ako intindi ko, if it's a national program, buong buo, naka-lodge yan dapat sa national government, right? So, unless there's a law somewhere that says, pagdating sa immunization, exception yan, ang LGU ang sasalo ng administrative cost. So, what's the legal basis for that practice?
Ma'am, kasi immunization falls within the entire primary care provision, for which based sa devolution, sa LGU code, yung primary care provision is really a responsibility of the municipal and city government. So parang mas nandun siya. So for the longest time, national immunization program siya just because we're buying the vaccines, but the implementation is with the LGUs. LGU code po na the primary care provision is care of the LGUs po.
But then I'm sorry, but that's subject to legal interpretation. Because for example, in the case of 4Ps, the reason for why Congress passed the institutionalization of 4Ps Act is precisely to take that away from the LGUs. Kaya nung na-institutionalize ang 4Ps and became a national program, buong buo, sinasalo yan ng DSWD, national. So again, that's subject to interpretation. Just because primary care is mentioned in the local government code, I mean, di ba, how do you implement that in light of a bill like this that says this is clearly a national program?
Kaya, ma'am, the other alternative. So if you frame immunization as population-based services, which is, it has been traditionally been defined as, then ano siya, di ba? Part siya ng national and local government na public health system. Yon. So kung ganun nga, ma'am, yung traditional, yung national government, di naman siya nag-implement on the ground. So everything is really through the LGUs. The other option, as what they've done in other countries, is to label it as an individual-based services. So then, that's why you reimburse services related to immunization administration. So pwedeng hybrid, either binibili pa rin ng government yung vaccines, dinidistribute siya even to private providers, but your insurance pays for the admin fee so that anyone can actually help administer at hindi mapapressure yung public system mo to do the administration. So those are routes that we actually can take. Pero yung ever since the program started, it's always been through LGUs, ma'am. So yun po.
The bottom line is, do you think this is a doable law? I mean, realistically, DOH. We can approve this, but can the government support its implementation down to the administration of the vaccine?
So I think the current feature of the bill expands the program that makes it that doesn't necessarily address the bottlenecks that we're currently experiencing po. So parang dumami yung vaccines, pero dun sa current vaccines nga, hindi pa natin optimized yung system. So we'd like to work with you on it. So issues on misinformation, etc., yun yung dapat na ma-address. Issues on budgets for implementation and incentives for implementation will also have to be put in place.
And then in the statement of the resource speaker from the Philippine Pediatric, wala ba tayong pondo para sa catch-up program? Wala?
Meron po for this year.
Because
And meron
I
po,
heard from Dr. Ong that there is no funds for catch-up program. There is.
Ngayon po meron.
There
And
is
we
a-
actually have a
there's
supplemental immunization campaign scheduled in May.
And in the proposal of Congressman Violago on limiting it to 0 to 5, I was thinking of retaining it, but adding the phrase focusing on the 0 to 5 age group, so that the other vaccine subject to the availability of funds in the future, nandyan na dun sa law. And this just my
Yes. And
my suggestion, if the authors would are amenable to it. Kumbaga, nandyan na rin yan, but we will focus on the 0 to 5, considering the limitations that we have, the budgetary and among other things.
yes. And
Yes, Congresswoman Kimbo.
I'm sorry, but I always get annoyed when the DOH uses the distinction between population-based and individual services as a cover for whatever they want to pursue. Sa akin, klaro it's population-based, right? Meaning there is an externality. When you immunize someone, not only does the LGU benefit from it, but all other LGUs, which is why you have a free rider problem. Kung ako, Bataan LGU, iniisip ko, teka muna, mga kabataan dito pwedeng bukas na sa Makati na. Wala talaga akong incentive na, teka muna, kailangan ko siyang bakunahan talaga because forever siya titira sa Bataan. 'Di ba? Bukas na sa Makati na yan, doon na siya manghahawa. Ang Makati na lang ang magbabakuna sa kanya. That's the reason for why, traditionally, it is population-based. Alam mo yan, Yusek Bev, right? So, and Congress has the power to define it as a national program, given those nuances, right? Pwede po yun. Ngayon, kung gusto rin natin bigyan ng responsibilidad ng LGU, pwede rin. May power din po ang Kongreso na define yan. Pero sa akin, kung magbibigay tayo ng responsibilidad sa LGU, bigyan natin ng kakayahan, di ba? And it may not be a budget per se, but again, I reiterate my recommendation earlier, pwede naman incentives. Diba? Kapag may ginastos ang LGU, halimbawa nagdagdag ng personnel deployed for immunization, may matching grant. Meron silang makukuha na dagdag na pondo or whatever support mula sa DOH. But again, so dapat gano'n yung pagtingin, di ba? Dapat magkaroon ng ganong framework ang DOH dito po sa pagpapatupad ng isang immunization program.
So can we settle first the suggestion of Kong Violago on the either we add the phrase focusing on the 0 to 5 age group, or refer back to the old.
Mr. Chair,
Yes.
actually, with our proposal with the Congresswoman Garcia, if we may refer back to the technical working group so that we could all the inputs be included, especially coming from Stella and other inputs that were given by the DOH. I don't know with the authors.
Anyone from the authors?
For me,
Yes,
originally
Kong
my
Kari.
bill chairman is from 0 to 5, ages 0 to 5.
So i-limit natin to 0 to
Opo.
5.
For me, I don't know about the other authors.
Is this under the present mandatory immunization? Is 0 to 5 lang ba tayo? DOH?
Sa current po, 0 to 5 lang, sir.
Is 0 to 5. How about the booster? Is it part of the mandatory immunization program and booster doses? From the Philippine Pediatric?
Sir, sa program po namin kasama, pero sa batas po hindi. 0 to 5 lang yung nasa law na mandatory.
Okay.
But we also implement school-based, for school-age children, but that's not included in the 2011 law.
Congressman Mike Tan? Or anyone in the Zoom na authors? Wala.
May I be allowed to manifest po?
1 minute recess.
Mr. Chair,
Congressman Violago first.
Mr. Chair, I withdraw my motion a while ago regarding referring the substitute bill to the technical working group. Instead, kindly just adopt, include prioritizing 0 to 5 ages for this bill, Mr. Chair.
Mr. Chair. May second. Motion.
I'm sorry. I think Congresswoman would like to give questions.
Okay. Sige, can we have Congresswoman Pancho?
Mr. Chair, to USEC, the proposed bill is the mandatory immunization program. And you said this is not really mandatory kasi it's true naman. You cannot really force the parents to bring their infants or children to the government facility or health centers. Kasi when you say mandatory, inuobliga mo, pinipilit mo na pumunta ang magulang kasama po ang bata. Now you said na nakabalik ang mga infants and children, of course, to the parents after the Dengvangsha issues. How many percent, ma'am, nun?
Ma'am, we're ranging from mga 60 Dengvangsha year 2017.
After the Dengvangsha, ma'am.
It's between 66, 69, 65, 62.
Medyo magandang number na rin po. So, ma'am, what did you do to encourage these parents to bring their infants and children again for vaccination, ma'am?
But ma'am, this is almost 10 percentage point lower than what it was before. So, hindi po tayo completely nag-recover pa.
So hindi pa rin po, ma'am. So, ma'am, pero ma'am, you were able to encourage the parents to bring their.
Yes po, we do supplementation activities or catch-up activities in the community with the help of the LGUs.
But you did not use the word mandatory.
No po.
So ma'am, any suggestion? Kasi if it is not, we cannot, hindi natin mapapwersa sila. So,
I think ma'am, we defer to the authors po on what the title they'd want to replace it with.
And another point pa, ma'am, kasi they're suggesting na 0 to 5. So ang suggestion ko po, yung 0 to 5, yung infant o yung child, nandun lang po sa loob ng bahay. So, ibig sabihin, kahit pa paano, yung virus, wala gano kasi nasa loob lang po siya ng bahay. Mas maganda siguro until school age na nag-aaral ng bata. Kasi po, that's the time na may expose siya sa school. Lalabas na siya dun sa kanyang comfort zone eh. So may expose na po siya sa virus, sa germs, at saka dun sa kanyang classmates. So yun lang po ang recommendation ko lang po kung sakasakali, Mr. Chair, 0 to school age po nung bata.
May we hear a comment from the Philippine Pediatric Society?
The vaccines that you give from infancy, is actually effective up to certain years. So it's not due to the exposure of the child, but due to actually it's the parents or those in the household, whom the child can be exposed to. So we can also bring the virus and the bacteria to the household. So yun lang po yung isang it's the age group is yung effect ng age group. You give it as early as possible because vaccination is a preventive measure. So when you say preventive measure, before they are exposed, you have to give the vaccine so that they can be protected when they go out or they are being exposed. And so we also agree that the different vaccines also have different age group indications. So most of the vaccines like BCG should be given at birth, like the DPT can be given as early as 6 weeks of life. And then there are just a certain number of doses that they can complete. And when they have completed it, and including the booster doses, then when they grow up, no, they don't need to have another dose of that vaccine. So the school age vaccines are the ones that are indicated for their age group. So for example, the HPV vaccine is indicated for 9 years old and above. So we cannot give that to the 0 to 5. So, but most of these vaccines that are available are the ones that we give from 0 to 5. So if yun nga po, we support that we give it 0 to 5, we prioritize giving of the vaccine to infants up to 5 years of age. But we also want to extend that beyond the 5 years of age, because there are new vaccines that should be given at the school age. And then there are also some vaccines that should be given as and when you go old, at the adolescent or adulthood. So pwede naman po yung yung age group up to school age, because that would cover most of the vaccines that are available. So we support that, but if you want to prioritize, the 0 to 5 vaccines are very good to cover for the entire population.
Thank you po.
Thank you, Doctora. Maybe go back to
Mr. Chair.
Sino yan?
Mr. Chair, Steve Solon Sarangani. I can go after, if someone was ahead of me, Chairman June, I'll yield the floor, sir.
Okay, can we have Congressman Busita first, and then we will let Congressman Solon after. Congressman Busita.
Yes, thank you, Mr. Chair. Good morning, everyone. Mr. Chair, actually, matanda sa Bayasume, kaya lang very interesting yung issue. At health ang pinag-uusapan dito, so nagbadali po ako na maka-attend. Mr. Chair, dito po sa draft bill nitong substitute bill, with due respect po do sa mga authors, ito pong word na mandatory, for me, as member of this committee, hindi po ako pabor dito. Again, with all due respect sa authors. Kasi po, from the word mandatory, wala po tayong nakikitang ibang justification dito eh. Kasi mandatory. Batas po ito. Pag naisa batas na ito, mandatory. So, parang wala nang rights yung parents doon sa kanilang mga anak. At kung babalikan po natin yung issue ng Dembaksya, hanggang ngayon po, sigurado, hindi nananahimik ang buhay ng pamilya ng mga sinasabing mga bata na nabiktima dito sa Dembaksya. Kung lalabas pa po ito na mandatory, wala nang rights yung mga parents. Pwedeng maulit-uli yung ganong insidente. And dito po sa Section 5, Mr. Chair, from line 131 to 34, sabi po dito, please allow me to read the paragraph. The DOH, in collaboration with the Department of Education and the Department of Interior and Local Government, shall undertake a school-based and community-based immunization program. Dito po, napakalinaw po, pag nagkaroon ng schedule ang schools, walang kalam-alam yung parents, pag uwi ng bata, naturokan na. Ang mga teachers and other personnel involved, legally, absulto do sa kanilang gagawin kung may sa batas ito. Kasi po, Mr. Chair, nakalagay po dito mandatory. So, Mr. Chair, aside from that, kung may labas at may pasa ito sa committee hanggang sa taas makalabas to, mandatory. So, meaning, meron na tayong obligasyon na pondohan yung bilyones na ituturok sa mga bata. So, malaking problema po ito, Mr. Chair. Again, with all due respect sa authors. You know, nang nasa active service pa po ako, and as advocate, anong sabi ng mga maliliit nating kababayan? Ang ating mga batas, butas-butas. Anong ginagawa ng mga congressman? So, Mr. Chair, with all due respect sa author, dapat po may correct na ito. Dahil once na mailabas ito, every member of the committee, lahat ng congressman, lahat ng involved dito, walang excuse once na makapasa po ito. Especially pag may problema na, anong gagawin natin kung may problema na? Magsisisihan tayo o magtitinginan lamang po tayo? Ang pinag-uusapan po kasi dito, Mr. Chair, buhay eh. Buti sana kung pag namatay ang bata, meron tayong vaccine na once na maiturok natin, mabubuhay yung bata. So my concern, Mr. Chair, is I don't think na may experts na magsasabi na once tinurok talagang 100% safe. So my point, Mr. Chair, is wag po nating alisan ng karapatan ang bawat parent para sa safety ng kanilang mga anak. And I don't think na may justification tayo or anybody para maka-skip doon sa word na mandatory. Mandatory, mandato, obligado. So, kawaawa po ang mga bata, kawaawa ang mga parents, and at the same time, once na maipasa po ito, whether we like it or not, kailangan pondohan ang kailangan ng DOH. And for me, as member of the committee, okay yan. Kung 100% sigurado tayo na mapoprotektahan ang mga bata. So yun lamang po ang pinapakiusap ko with respect to the authors of these bills, Mr. Chair, na maging maingat po tayo. Kasi po, we as elected public servants, tayong lahat ay temporary lamang dito. At kapag may problema na, napakasakit na instrumento tayo na doon sa huling hibla ng hininga natin, nagsisisi tayo. Kaya, Mr. Chair, again, with respect to the authors of the bills, maging maingat po tayo. Pag naipasa natin to, ilang years, wala na tayo sa position. Pero, wala na. Buhay po ang pinag-uusapan dito eh. And rights of the parents. Sino po ang sisisihin dito? Tayo. So, Mr. Chair, maging maingat po sana tayo dito sa batas na ito. Masyadong kawaawa ang mahihirap nating kababayan. Kasi po, nakakaalarma itong term na mandatory. Ang parents wala nang control dyan. Pagpasok sa eskwela, pagbalik, nanay, mami, daddy, tinurukan po kami. Wala na. So dalawa po ang issue dito. Nalalagay sa peligro yung buhay ng mga bata, mawawala ng karapatan yung kanilang mga parents, at malaking pera po ang magiging involved dito na kailangan pondohan ng ating pamahalaan. Yun lamang po, Mr. Chair.
Thank you, Congressman Busita. We will take note of your inputs. May we call Congressman Solon, and then after that, Congressman Mike Tan, one of the authors. Congressman Solon.
Thank you, Chairman June. So this question is for the DOH, although I do agree with what Congressman Busita said about the word mandatory. I apologize for inserting another issue of concern here. I'll give you a live case study. Sarangani province has always been awarded for its its rollout of the vaccination program, and I'd like to thank the DOH who is in partner with the LGUs, even down to the barangay, with the provision of health workers, like nurses, and to the barangay, so on and so forth, to administer the vaccines. Ang isang problema po namin sa Sarangani naman is the supply of the vaccines, DOH. So in other words, example, I just spoke to our health officer now. The routinary vaccines is what they call it. Let's say the vaccines for children 0 to 5, example, hepatitis B and things of this nature. Ang nagiging problema sa Sarangani po is we are able to administer whatever DOH gives because we are in partnership with the DOH. Our advocacy to media is very good in terms of vaccination. Yung problema namin is to supply DOH kasi it comes in late. No, I guess it's the budgeting process of the government. I'm not sure, but example, sir, dumarating na yung vaccines maybe third quarter. So yung 1 year, the time period where you're supposed to vaccine children before 1 year old, naglalapse na po siya. So like I said, I apologize for putting another issue on the table. That issue is the proper supply of vaccines to LGUs that have a good vaccination program. Thank you, Chairman June.
Thank you, Congressman Solon. Congressman Tan, one of the authors.
Yes po, Mr. Chair. On the point of Congressman Busita po and yung issues regarding sa term na mandatory, I think wala naman pong issue kasi more on yung mandatory po is with regard to the immunization program ng DOH na magme-maintain sila ng immunization program. Hindi po yung sapilitang babakunahan po yung mga bata. More on dapat yung DOH as an agency po nagme-maintain siya ng immunization program kaya po naging mandatory. So on the point po na mag-focus po dun sa 0 to 5, amenable naman po ako. Kung papayagan po na yung suggestion po nakalimutan ko po yung research person natin na kung pwede i-extend ng early ages ng even after 5 years old para po makover halos lahat po ng vaccines, amenable rin naman po. Yun lang po, Mr. Chair.
Okay, so your point is to retain the word mandatory.
Yes po, Mr. Chair. More on sa hindi po siya yung, well, alam naman po natin hindi po tayo pwedeng magpilit na bakunahan yung mga bata and other individuals. More on mandatory po yung programa under the DOH.
Okay. Congressman Busita, are you satisfied with the explanation?
Mr. Chair, if I may,
Okay,
I
Congressman
have a
Biolago.
proposal, no? Para medyo yung author at saka yung yung ating colleague si Congressman Sita regarding sa mandatory word. If it's possible, just a suggestion, instead of mandatory, use the word institutionalizing national immunization program.
In other words, are you open, the authors, may I ask the authors, are they open to revising or rephrasing the title, replacing the word mandatory to another word? Is that amenable to the authors? Congressman Tan?
Mr. Chair, kasi basically, ang fina-follow lang naman po natin yung previous law, yung mandatory immunization for children. So, I think po, wala naman pong problema talaga since yun naman po talaga yung existing law.
But we are, the bills here are basically repealing the present law, the mandatory law.
Yeah, we're expanding po, pero kung magfo-focus po dun sa 0 to 5, more on mag-a-amend ka na lang po if ever. Kasi ang additional na lang po dun sa law, sa proposed bill po is yung NITAG.
Okay.
More on nagiging, kung magfo-focus po tayo doon sa 0 to 5, nandun pa rin po yung existing law, more on nagdagdag lang po tayo nag-NITAG.
Okay. Thank you, Kong Mike. May we hear from Dr. Ong from the PP, Dr. Ana Ong Lim, Dr. Ana Ong Lim.
Thank you po. Thank you po, sir. If I may be allowed to suggest, dahil nga po yung considerations ng mandatory, naintindihan ko naman po yung bigat nung dating nung word na yon, particularly to the public. So since if we look again at our important goal, which is to achieve the highest level of coverage, regardless of the mechanisms being employed, yun pong mga concerns about the word mandatory can be addressed by using other words that have the same implication. Perhaps the word routine or institutionalizing would be acceptable. So yun pong mga concerns na sinabi po ni Representative Busita regarding matuturukan po ang bata, uuwi na lang sa bahay, hindi po man lang nalaman sa mga magulang. Hindi naman po yan nangyayari. Kasi po kahit sa current system na may mandato po tayo o safe mandates, meron po parating permission slip na ibinibigay sa mga magulang para sila po ay pumayag or hindi pumayag na magpabakuna. So babalikan ko lang po, yun din pong nababanggit kaninang option na 0 to 5 years. Kasi po kung ang atin pong tanong na gustong sagutin is paano ba natin pagkakasyahin tong pondong to na napakarami pong taong kailangan natin bakunahan. Ang pinaka-rational pong approach is to look at burden of disease rather than restricting to age. Dahil nga po, minsan nakikita natin, tulad na lang po ng experience natin sa COVID, hindi naman po bata ang naging target nun kung hindi yung mga matatanda. So we don't want to tie our hands using that kind of phrasing kasi pwede pong magbago yun pong pangangailangan ng ating health system. Maraming salamat po.
Thank you, Dr. Ong Lim. Dr. Violo, Congressman Villago. Okay na? Wala. Motion na. So if there are no from PhilHealth, is the representative from PhilHealth still on board? Wala.
Mr. Chair.
Yes. Dr. Bravo, brief comment.
Yes, thank you. And thank you for our congressman, our good congressman. We do need to increase our vaccination rate. And we know that for measles to be eliminated, we need 95% coverage. And that was that's why Dr. Beverly Ho says we do need to get this up. And Dr. Juan Flavier in 1990 to 1993 as Secretary of Health came up with a very good program of catch-up vaccination. If you remember, every April, the whole month of April, almost 5 to 8 million children were being vaccinated with polio, DPT, and measles in order for us to be able to eradicate polio in 2000 and almost eliminated measles in 2005. This is what we really want to see for our country because we always believe that with working together, the LGU, the DOH, and of course the private sector, the NGOs, working together to avoid disease outbreaks which are now threatening our country. Because epidemics like this, measles or even dengue, could really make our country a state of emergency that could scare away not just business, but tourists even. And we know, I mentioned earlier po, that the Philippines, based on WHO incidents, has the highest rate of dengue in the whole Asia Pacific and also meningitis and possibly even pneumonia. And we have not yet rebounded from our pre-COVID vaccination rate, unlike that of other countries like Malaysia, Indonesia, like Thailand, Taiwan. They did not have this problem. Our problem is really communication and advocacy. And to me, what will make us really improve that, and I think this was done to be able to communicate well and advocate. And the Philippine Foundation for Vaccination has been doing this since 2000. We want to make sure that the value of vaccination is brought to the public, brought to the masses, even to the policy makers. And we are able and we are willing to help our policy makers. This is what we really hope for, a working together among our peers, among colleagues, scientists, academicians, and everyone else. And thank you very much.
Thank you, Dr. Bravo.
Chairman June.
Yes, Congressman Solon.
Yeah, Chairman June, I was hoping to just get a response from DOH. So let me restate the question. In order for us to get the vaccination rates up in LGUs, one issue is the supply of the vaccines being downloaded. Can you talk to that a little bit at DOH, how you can improve that? I mean, because obviously lack of supply means lower vaccination rates. Thank you, Mr. Chairman.
The DOH, Yusek Bev.
Thank you, sir. Admittedly, this is really a challenge for us considering that most of the vaccines that we procure now are through the local market, and syempre, most of them don't have a single supplier, so they go for public bidding. And this is really the challenge when you're not assured kung mag-fail or mag-succeed yung bid mo. We have tried to remedy this by asking for language in the special provision in the GAA, allowing us more flexibility in terms of procurement of vaccines, but this was disapproved. And that's why also in our statement po kanina, we wanted also some language around multi-year contracting, and this will in a way di naman run contrary but really be a special case under the GPPB po dapat. Kasi otherwise, in the past, we have remedied this by buying from international through our UNICEF. But in the past few years, we've moved to local suppliers largely because they're now more available. Pero yun lang, we could not ensure that it's always successful bid. And in those cases, parang we will have to really just have delays.
In other words, your hands are tied at this point, so wala tayong maibibigay na solution dun sa problem na stated by Congressman Solon?
Yes, sir. What we try to do is we do early procurement activities by August of every year before. So parang ngayon po yung vaccines for this year, they're all filed na for procurement as early as August of 2022. But yung success rate, that's what we couldn't predict lagi. Kasi medyo madami naman po yung nagbibid.
There's a
Um,
problem on bureaucratic procedures, red tape.
Sir, I think it's really just the nature. If it's an open bid, you cannot predict na successful siya lagi. It's a procurement process po. So unless, for example, we'd be tied to say, use UN agency to procure, tapos advance payment na sa kanila. Kasi those are things na hindi naman po pwede under normal circumstances. So if the bill will address it through those routes, like parang sa COVID-19 vaccination, di ba? Expedited yung procurement because we really didn't go through the usual process. Then we could probably assure na nandyan siya lagi. Over po.
Congressman Solon.
Yes, Mr. Chair. So anyway, I'm just, it's my prayer that the DOH can come up with a efficient supply, because no matter what measures we pass here today, if we can't get the supply proper, the next meeting, the DOH will say the vaccination rates are low because there's no supply, the supply is lacking. No? So yeah, it is my prayer that we can get that system fixed so you can really roll out a proper vaccination campaign. Thank you, Chairman June. Salamat po.
Thank you, Congressman Solon. I think the more reason we should expedite the approval of this bill so that we can insert in the provisions regarding the acquisition of the vaccines to expedite or to address the problem as presented by Congressman Solon.
Mr. Chair.
Yes, Congresswoman Garcia.
Yes, there's pending motion by Congressman Violago, and I would like to second with kind indulgence of all the authors and all our members. I'd like to second the motion of Cong Violago, institutionalizing a national immunization program, expanding the existing Republic Act number 10152, and incorporating all the comments of all our members and our stakeholders in the substitute bill. So basically what we're saying is that we realize the importance of vaccination. We are creating the NITAG to give guidance to DOH on what to prioritize on in expanding the 0 to 5 existing Republic Act. So I second the motion of Congressman Violago, Mr. Chair.
So there's a motion by Congresswoman Violago and duly seconded by Congresswoman Garcia that we will rephrase the title of the bills into institutionalizing the national immunization program, expanding the national immunization program, expanding the Republic Act 10152. Are there any objections? Hearing none, the motion is approved. So do I hear a motion for the approval of the substitute bill?
Mr. Chair, I move to approve the substitute bill subject to style and other amendments, Mr. Chair.
Second, Mr. Chair.
So there's a motion to approve the substitute bill, duly seconded, subject to the style and amendment and pending the submission of the official position paper from the Department of Health and other stakeholders so that we can incorporate your position into the final consolidated substitute bill.
Mr. Chair. Mr. Chair.
Yes, Congressman Busita.
Gusto ko lang po magpasalamat sa ating colleagues, Congresswoman Garcia and Congressman Bilago para doon sa motion nila. Maraming salamat po. At least may peace of mind na ako.
So
Thank
may
you.
I finish my so there's this motion duly seconded and subject to the style and amendment and pending the submission of the position papers from our different stakeholders. Hearing no objection, the substitute bill is now approved. Congratulations to the authors. So we now proceed to the deliberation with the local bills. First is House Bill number 5600. Okay. Authored by Congresswoman Angela Garcia, Congressman Albert Garcia, but will be sponsored by Congresswoman Angela Garcia in his behalf.
Thank you, Mr. Chair. Good afternoon to everyone. On behalf of Congressman Abet Garcia, I would like to sponsor House Bill number 5600, entitled An Act Increasing the Bed Capacity of Bataan General Hospital and Medical Center in the City of Balanga, Province of Bataan, from 500 to 1,000 beds and upgrading its services to include the operation of a cancer center and appropriating funds therefore. May I move to adopt the explanatory note as the sponsorship message in the interest of time. Thank you, Chair.
Thank you very much, Congresswoman Garcia. May we hear from the resource person, Dr. from the HFDB, Department of Health, Dr. Melissa Sena.
Thank you, Mr. Chair. The DOH fully supports the increase in bed capacity and the upgrading of services of Bataan General Hospital. However, we recommend to remove the specification of cancer center in the title and instead state upgrade its specialty capability to become an Apex hospital. Thank you, Mr. Chair.
Salamat.
Mr. Chair.
Yes, Congresswoman Garcia.
Yes, on behalf of Cong Abet, we agree with comments and corrections in the title of the bill. Thank you, Mr. Chair.
Sino pa?
Sir, yung House Bill number.
Hindi, approve na ba natin yung ano? So if there are no other, yes, Dr. Glory Baltasar.
Thank you, Mr. Chair. Bataan, on behalf of Bataan General Hospital, we are grateful for the bill sponsored by Cong Abet and Congressman Gila, and also for the position of the DOH on supporting the increase in the bed capacity of our hospital and putting funds and effort to make it as an Apex hospital. Thank you, Mr. Chair.
Thank you, Dr. Baltasar. If there are no other comments, do we hear a motion for its approval?
Mr. Chair.
Yes,
Mr. Chair,
Congressman Bilago.
I move for the approval of House Bill number 5660. I'm sorry. I move for the approval of House Bill number 5600.
I second the motion.
So there's a duly seconded motion to approve House Bill number 5600. Hearing no objection. House Bill number 5600 is approved.
Mr. Chair.
Congratulations. Yes, Congressman.
To manifest our solid support dahil kami rin po ni Kong Gila ay taga Bataan. I also move that Congresswoman Gila and I and all the members present in the committee be made co-authors of the said measures.
Thank you. There's a motion to include all the members present here today physically and virtually to be co-authors of the bill.
Second the motion.
Duly seconded. Hearing no objection, the motion is approved.
Thank you, Mr. Chair. Thank you, honorable members of this committee.
Thank you, Congresswoman Garcia. We now proceed with House Bill number 5398, authored by Congressman Rufus Rodriguez.
Mr. Chair,
Congressman Biologa will.
on behalf of Representative
sponsor.
Rufus Rodriguez, I am sponsoring House Bill number 5398 entitled An Act Establishing in the Philippine General Hospital located in Manila City, National Capital Region, a facility to be known as Bantay Antayan and appropriating funds therefore. And let the explanatory note, Mr. Chair, be the adapt as a sponsorship speech, Mr. Chair.
Thank you, Congressman Biolago. May we hear from the Director of the Philippine General Hospital, Dr. Gap Ligaspi.
Good afternoon, Mr. Chair, Your Honor, to the rest of the Honorable Congress. I'd like to thank you for allowing us to share our gratitude with you for this bill, and just to convey the message that it's very timely for us to have this facility, because I think as the DOH has seen yesterday when they did an inspection of our of the premises of PGH, especially around the emergency room, the relatives and the watchers of our patients are really spilling over all the vacant spots here around the emergency room. So this bill is very timely. I hope the construction of this bill proceeds soon, and the benefit is gained by our constituents here in the Philippine General Hospital. If I may just be allowed to share our position paper in the last joint meeting, committee meeting, we stated that it be not limited to the watchers of the emergency room, because it specifically states in the substitute bill that the Bantayan will be for patients being treated in the emergency room of the Philippine General Hospital. I think it will, with the appropriated funds, we can build a facility enough to be a secondary shelter also for other watchers in the wards of the Philippine General Hospital. If I may add that, as we attested on our position paper in September 29, 2021, Your Honor.
Thank you, Dr. Gap Ligaspi. From the Department of Health.
Thank you, Mr. Chair. The DOH interposes no objection to the bill, as we are cognizant of the affirmation from the PGH for the necessity of the establishment of Bantay Antayan facility. We just recommend that it should be consistent with the hospital development plan of the PGH, and also that the facility will be sustained with necessary appropriations for its operation, and also for human resource complement. Thank you, Mr. Chair.
Thank you, Dr. Racenes. I'd just like to make a manifestation that I fully support this bill. Having come from the Philippine General Hospital myself, I know and I understand the situation of the bantays, mga bantay sa hospital, and I think also in other big government hospitals. But with this bill, I fully support this House bill authored by Congressman Rufus Rodriguez.
If I may, Mr. Chair.
Yes,
I
Congressman.
move for the
Biolago.
approval of House Bill 5398.
I second, Mr. Chair.
I second the motion.
So there's a motion and duly seconded that House Bill number 5398 be approved. Do I hear any objections? Hearing none, the House Bill number 5398 is now approved. Congratulations, Director Gap.
Thank you, Your Honor. Thank you.
We now proceed with House Bill number 5875, authored by Congressman Joseph Gilbert Violago.
Mr.
Congressman Violago, you have the
Mr.
floor.
Chair, I'm sponsoring House Bill 5875 entitled An Act Establishing a Level 2 General Hospital in San Jose City, Nueva Ecija, and appropriating funds therefore. Mr. Chair, if I may deliver my sponsorship speech. In the 1987 Constitution provides that the state should protect and promote the right to health of the people and instill health consciousness among them. Likewise, the state shall adopt an integrated and comprehensive approach to health development, which shall endeavor to make essential goods, health, and other social services available to all the people at affordable costs. There shall be priority for the needs of the underprivileged, sick, elderly, disabled, women, and children. Finally, the state shall endeavor to provide free medical care to paupers. According to the 2020 PSA census, the 2 cities and 6 municipalities comprising the 2nd district of Nueva Ecija have a total population of almost 500,000. Despite the growing population at present, there is no level 2 hospital in the legislative district which will answer the needs of almost 500,000 people. For this reason, the constituents are forced to travel to Cabanatuan City or Baguio City, thus incurring additional expenses. Because the current healthcare system in the legislative district cannot accommodate all the patient's needs, especially the care that only level 2 hospital can provide. A level 2 hospital offers emergency and outpatient services, isolation facilities, surgical, maternity facilities, departmentalized clinical services, respiratory unit, general ICU, NICU, dental clinic, tertiary clinic laboratory, blood section, second level X-ray, etc. These services are essential to the medical needs of the public. With the said, the present proponent is willing to donate 1 to 2 hectares of land located in San Jose City, Nueva Ecija, to the national government for the construction and operation of a level 2 hospital. This bill seeks establish level 2 general hospital in San Jose City, which shall be under the direct supervision of the Department of Health. This will ensure that the constituent within the legislative district and nearby places will have the access to quality, safe, and affordable medical care without incurring additional costs from traveling to other provinces. In view of the foregoing, the urgent passage of this measure is sought. Thank you, Mr. Chair.
Thank you, Congressman Violago. From the Department of Health, Dr. Melissa.
Thank you, Mr. Chair. Considering that Nueva Ecija is classified under the Philippine Health Facility Development Plan as a province with high capacity and low gap for health facilities, the DOH supports the proposed establishment of Dr. Eleuterio R. Violago General Hospital, provided that it shall be under the direct supervision and control of the province. Thank you, Your Honor.
Thank you, Dr. Melissa. Dr.
Mr. Chair?
Congressman Violago.
Yes, actually right now we have a level 1 hospital under the supervision of the province. And we all know that due to budget restraint, yung level 1 general hospital is not actually function as level 1 because of problema nga sa budget. And yet, with my experience, no, that's why I'm pushing na national ang mag-administer, just like the one in Talavera right now. Meron ho kayo sa Talavera. So why not come up with San Jose, no? Yung sa Talavera na bagong national hospital din, kaya nagawa yun kasi hindi na rin kaya ng Cabanatuan. And the province of Nueva Ecija is practically almost 2 million in population. And then ang traffic congestion sa Cabanatuan sobra, no? So that's why I'm proposing for a level 2 na under ng Department of Health. And I think I will also seek the help of our president, since nabanggit naman na ating presidente na kailangan talagang madagdagan pa yung hospitals, no, outside Metro Manila. So I hope that medyo mabago yung stand ng Department of Health, no, especially kung nabanggit naman ni President BBM na there's a need, no, there's a need. Yun lang, Mr. Chair.
How far is the nearest level 2 hospital from
50 kilometers.
So 50 kilometers
With
away.
with all the traffics and everything, because there is there's a national highway, but it will take you an hour, no? An hour or more. It depends with the traffic, but it's a minimum hour, no? That's why we're pushing for this, no? Kasi ang Cabanatuan is practically na siya, grabe ng traffic jam sa Cabanatuan. So usually marami namamatay pa sa sa ambulance due to yung sa travel time.
With the population of 500,000 and with no level 2 hospital within that vicinity, I mean within that community, and then the nearest level 2 hospital is 50 kilometers. I see no reason why the bill should not be approved. Yes, Dr. Melissa.
Sir, we support the establishment of the hospital, and also the ideal time or access time to a hospital is an hour access. And the proposed site is within 1 hour access from both from the 2 DOH hospitals in the province, which is the Paulino J. Garcia Memorial Research and Medical Center, and also the Talavera General Hospital. And however, considering po the Universal Healthcare Act, which seeks to strengthen yung healthcare provider networks in the provinces and also the cities, so we recommend, sir, that the proposed hospital to be established shall be under the province, sir. Thank you.
I'll go back. There's a level 1. Level 1 under the supervision of the province. As I've said, with the budget constraint, yung level 1 niya hindi na makapag-perform. And now you want the level 2 to be supervised by the province. That's why I'm seeking the help of Department of the Department of Health na i-consider, no, na it will be under the national, just like the one in Talavera. Kasi meron naman na tayong president eh. That's what I'm telling. Kung wala sana tayong president, hindi ko na may pupush to, no? And even the private hospital, wala kaming level 2. Ang private hospital namin nasa level 1 din. So practically, basta level 2 na yung problema ng patient, it's Baguio or Cabanatuan, no? And then very congested ng Cabanatuan. Kaya I hope na i-reconsider yung standing nyo, Mr. Chair.
So
we will ask our execom, sir, because we haven't submitted yet our final position paper, but it's subject to the decision of our execom. But for now, that is the draft DOH position paper. Thank you, po.
I'm sure there can be a compromise somewhere. We understand the position of the DOH and also the position of Congressman Violago, But I understand in some cases, nagkakaroon din naman ng support from the DOH. Yung similar bill in your case. So if there are no other comments, we can maybe hear a motion for its approval.
Yes, Mr. Chair. Considering the explanatory note and the sponsorship speech of Congressman Diolago, I would like to move for the approval of House Bill number 5875, an act establishing a level 2 general hospital in San Jose City, and appropriating funds therefore. Thank you, Mr.
Chair. Second, Mr. Chair.
So there's a motion by Congresswoman Garcia and duly seconded by Congressman Cruz for the approval of House Bill number 5875. Hearing no objection, House Bill number 5875 is now approved. We'd like to acknowledge the presence of Honorable Ricardo Cruz. Thank you very much for your attendance. And now we move to the last bill, House Bill number 6090 by Congresswoman Jaisel Victoria Yu via Zoom. Congresswoman Yu.
Yes, Mr. Chair.
You have the floor.
Thank you, Mr. Chair. Good afternoon na po to Mr. Chair, to my colleagues, and to the resource personnel in this meeting. I am honored to sponsor House Bill number 6090, entitled An Act providing for the establishment of a district hospital in the municipality of San Miguel, province of Zamboanga del Sur, to be known as San Miguel District Hospital, and appropriating funds therefore. His Excellency President Ferdinand Marcos Jr. emphasized in his first State of the Nation address the need for a stronger healthcare system, and also with the recent pandemic of the novel coronavirus, it has taught us to improve our ability to cope up with likely future epidemics and to improve po our basic healthcare needs in the country. In our province po, in 2020 census, the Philippine Statistics Authority announced that the province of Zamboanga del Sur has a population of 1,050,000 plus. From 2015 to 2020 po, it has an annual population growth rate of 0.82. And with that, the growth rate is overwhelming the standard of hospital bed to population ratio prescribed by the DOH. So with this po, Mr. Chair, I would just like to share that in our province po, we only have one provincial hospital and one regional hospital, which is in my district. Unfortunately po, the provincial hospital is located in the first district, and we are in the second district. And the regional hospital is in Margo sa Tubig, which is a town in the border na po to the next province. This district hospital po will be our very first district hospital, and we specifically chose the municipality of San Miguel po because San Miguel is in the center of my district. So with regards to accessibility, we can provide, or we can give our constituents the accessibility to a better healthcare system, and also increase the bed capacity po to help to the healthcare system in our province. So with that said po, for these reasons, I would like to humbly ask also my colleagues and this committee for your support to the approval of this measure. Thank you very much, Mr. Chair.
Thank you, Congresswoman Yu. Dr. Melissa from the DOH.
Thank you, Mr. Chair. The province of Zamboanga del Sur has a bed to population ratio of 1:562, which is within the ideal ratio of 1:1000. And also the DOH already has 4 hospitals in the province. Considering that the 2 hospitals are located in the city, but they still serve the whole of the Zamboanga del Sur. And also, the province is considered as a low capacity province, but also low gap for health facilities. So therefore, the DOH interposes no objection to the proposed establishment of San Miguel District Hospital, provided that it shall be under the direct supervision and administrative control of the province. Thank you, Mr. Chair.
Thank you, Dr. Melissa. Any comment from the members?
Mr. Chair.
Yeah.
Sige, Mr. Chair.
Yes, Congressman Nisay.
Mr. Chair, considering na narinig na po natin ang posisyon ng DOH, I move for the approval of House Bill 6090 entitled an act providing for the establishment of a district hospital in the municipality of San Miguel, province of Zamboanga del Sur, to be known as San Miguel District Hospital, and appropriating funds therefore by Representative Jaisel Victoria Yu. So move, Mr. Chair.
Second.
So there's a motion to approve House Bill number 6090, duly seconded. Hearing no objection, House Bill number 6090 is now approved.
Thank you very much, Mr. Chair.
Thank you. Congratulations, Congresswoman Yu. For other matters, maiksi lang ito. Today we launched the website, the official website of the Committee on Health. So let me read a brief statement. In the interest of House Secretariat's mission to support the members of the House of Representatives through its technical services and state-of-the-art infrastructure, this is to officially launch, for the benefit of the members of the Committee on Health, the official website of the Committee on Health at committeeonhealth.com.ph. Capital letters yon lahat. Starting 12 noon today. Our dear committee members and your respective offices can now access this website, which is a rich source of knowledge and information and an avenue for sharing resources, our committee members, congressional staff, and committee staff. This is the capstone project of the Committee on Health Secretariat staff, entitling Enhancing the Knowledge Sharing Capabilities of the Committee Affairs Department, quote, which seeks to enhance the efficiency of the committee in its delivery of services, mainly to its primary target market, which is us, the members of the committee. Aside from vital documentary requirements such as the committee reports, agenda minutes of the meetings, spot reports, and video recording of our meetings, and status of measures, which are crucial in our legislative functions, it also contains materials from past landmark legislation such as the Universal Health Care Act, as well as important resources like the requirements in the establishment and upgrading of hospitals and the Department of Health Facilities Development Program, among so many others. We envision the use of this website shall increase the efficiency in the work of both the committee secretariat and the congressional staff by lessening the transaction costs brought about by the numerous phone calls and emails done daily, even on weekends, and will give them more time to focus on their technical work, such as research and bill drafting. This shall benefit us, House members, as well as we can have these vital resources ready whenever we need them in the exercise of our legislative responsibilities. Please note that in the interest of data privacy, the resources therein shall be accessible only to the members of the committee during this pilot implementation phase. It is our fervent hope that this project shall be the basis later on for an agency-wide implementation for a more extensive knowledge-sharing portal of all legislative committees. As discussed last week by the committee secretariat during the consultative meeting with the congressional staff, may we request your offices to submit your official email address to the COMSEC so that you will be given access to this website. Thank you very much. For the information of everyone, Ms. Dayan Villordon is the head of the website.
Thank you, sir.
So that is all for the other matters. So do I hear the favorite motion of the members of the committee?
I move for the adjournment.
So there's a motion to adjourn, duly seconded. Hearing no objection, the meeting is now adjourned. Maraming salamat, committee members and resource speakers for today and this afternoon's meeting. Thank you. Thank you, sir.
Congrats, Chair.
Thank you.
COMSEC.
Thank you.
Thank you, ma'am. Thank you very much.